cuts will force millions off their insurance. Enforcing these tax credits to expire means millions of Americans will see their healthcare costs rise, some as much as double or triple what they currently pay. Because of Republicans' cuts, 15,000 people in my district will see their monthly healthcare costs rise, while another 5,000 will lose health coverage. A typical family of four earning $64,000 a year will see their monthly health insurance payments go up by an average of $214 or over 200%. This is all in addition to the over 30,000 in my district who will lose health coverage from the Medicaid cuts. I think I'm in the wrong one. Cynthia, one of my constituents, shared with my office that she desperately needs her meds. Cynthia takes 10 medications, which she can't afford without Medicaid. If she doesn't take her medication, she could die. Healthcare costs are just too expensive. When Democrats were in charge, we passed legislation to lower Americans' healthcare costs. We capped insulin at $35 a month. We passed legislation that allowed Medicare to negotiate drug prices. We made health coverage more affordable through enhanced ACA premium tax credits. Meanwhile, Mike Johnson has sent House Republicans off on their third week of vacation. They are nowhere to be found, but families deserve better. You deserve better. Democrats are going to fight like hell to reopen the government and stop healthcare costs from skyrocketing. Because if Republicans get their way, then healthcare will simply become too expensive for everyone. Too expensive to get the care you need, too expensive to visit the doctor, too expensive to live. Now we'll have a video.
What are Republicans doing to your health care?
We're going to see millions of Americans' health insurance premiums double and even maybe upwards from that.
And it's not just healthcare costs. Under the Republican administration, grocery bills are up, rent's up, utilities, childcare, and now with premiums set to double. It's becoming too expensive to live.
I think that's completely unacceptable, and I think that's unfair.
That's why Democrats are fighting to make life affordable.
Now it's my honor to turn it over to our leader, Hakeem Jeffries.
Thank you to Co-Chair Kelly. I also want to thank Co-Chair Debbie Wasserman Schultz and Annette Barragan for your leadership, for convening us here today. And of course, I want to thank our witnesses who are here, Heather, Jackie, Jana, and Dr. Ellison. Thank you for your presence. Thank you for your willingness to appear at this hearing, to tell your stories, not just on behalf of yourself, your family, but your patients, your colleagues, your coworkers, community members, and the American people. It's an honor to join all of my colleagues in the House Democratic Caucus as we continue this effort to find a bipartisan path forward to enact a spending agreement that actually meets the needs of the American people, to reopen the government, but to decisively address the healthcare crisis that continues to devastate the American people. Today is day 15 of the Trump-Republican government shutdown. Chaos and confusion and cruelty unnecessarily being visited upon the American people by my GOP colleagues. And why have Republicans decided to shut the government down? It's because they are unwilling to provide health care to working class Americans or extend the Affordable Care Act tax credits that tens of millions of people rely upon to be able to go see a doctor when they need it. Republicans have created this devastating healthcare crisis. It's impacting people, as we will hear, from all across the country. Working class America, rural America, urban America, small town America, the heartland of America, and Black and brown communities throughout the United States of America. We're all in this together, and that's why Democrats in the House and the Senate have remained unified, standing up for the health care of the American people. As we speak, we know that notices are going out to millions of Americans informing them that their health insurance premiums are about to skyrocket. In some cases, double, triple, or quadruple what people are currently paying. Many will no longer be able to afford the health care that they need. Others will be forced into medical bankruptcy. Neither situation is affordable. Neither situation is appropriate here in this country. the wealthiest country in the history of the world. So as Democrats, we're going to continue to hold firm, to fight to cancel the cuts, lower the costs, and save health care for the American people. And again, thank our incredible witnesses, our patriotic witnesses, for your presence here today. And I look forward to your testimony as we forge ahead on behalf of the American people. It's now my honor to yield to my good friend, the Honorable Democratic Whip, Catherine Clark.
Thank you so much, Leader Jeffries. We are so grateful for all you are doing to frame this fight and to be in it with all of us. To the co-chairs of the Steering and Policy Committee, thank you for this hearing. To my other friend and leader in leadership, Chairman Aguilar, and to all House Democrats who are continuing to hold the line for working families. But above all, I thank our witnesses. Your testimony cuts through the chaos and underscores what all of this means in real terms for everyday families. And we are just a few weeks from ACA open enrollment. And every day we are hearing stories from people across the country. The mom of two in Wisconsin, whose premiums are going to jump by $800 a month. The Trump supporter in Florida, who says this is not what he voted for, as his wife's premiums are going up $700 a month. The families in each of our districts and that you are representing through your testimony who are scrambling, figuring out what they're going to do, trying to piece together how they will get through this. And it is hard to overstate the magnitude of this crisis because it touches every part of our healthcare system. Hospitals are closing, nursing homes are threatened, pregnant women are having a difficult time finding an obstetrician. We're talking about veterans getting kicked off of their insurance, children who can't go to the pediatrician, and none of this is limited to any one family or any one part of our country. Some on the other side of this like to talk about retribution against blue states, but that's not what's going on here. Take my constituents in Massachusetts and Speaker Johnson's in Louisiana. And at home in Massachusetts, 35% of children are covered by Medicaid. In Louisiana, it's 54%. In Massachusetts, 32% of the births are covered by Medicaid. In Louisiana, that jumps to 64%. 64% of all births. A couple making $88,000 in my district is going to see their premiums double. In Mike Johnson's district, that same couple will see their premiums triple. The choices Republicans are making have and will hurt their own constituents, as the gentlewoman from Georgia has made that point quite clearly. I am honestly a little sickened, but not surprised that she is the only Republican who's speaking out about what's really going on. But that's why we're here and why we're so grateful to all of you to lay out the truth, to demonstrate exactly what the GOP is doing and what it means for American families. And to that end, we are so fortunate to be joined by the second time today by Jonna Higgins-Freese, a mom from Iowa City who knows firsthand the importance of Medicaid to her family and to her children. Thank you for taking the time to join us today, and the floor is yours.
I said to push the button and I forgot. My name is Jonna Higgins-Freese, and my family has lived, farmed, and worked in Iowa since the 1850s. I'm here today as a private citizen and mother of 2 kids with critical and chronic illnesses who use Medicaid. When Senator Joni Ernst and Representative Marionette Miller Meeks, my representatives, were voting for the big brutal bill to take working people's money away from Medicaid and Social Security to give handouts to the rich, someone shouted to Ernst that gutting Medicaid would kill an estimated 50,000 people a year. And Ernst said, "We're all gonna die." My babies were both sick from the instant they were born in Iowa City. My older son already died once. He was born in cardiac arrest. I lay in the silent delivery room while the doctors and nurses were scared, waiting to see whether my kid could be resuscitated. So I don't need my elected officials to tell me that we're all going to die. I need representatives like Miller Meeks to stop stealing the money that helps my kids have a good life. To Representative Miller Meeks, if she were here and would speak to me, she said that hell would freeze over before she holds a public town hall on this topic. I say, you took an oath as a physician to do no harm, but you have shut down the government because you refuse to make sure people can go to the doctor and get their meds. I haven't slept through the night in months. I wake up terrified about a lot of things this regime is doing that hurts the people I love, including how my family can live with these Medicaid cuts. There are 600,000 other Iowans just like me who can't live without Medicaid. That's 1 in 5 Iowans. And many of them don't even know they're on Medicaid because it's been privatized, and so it's called Molina or Iowa Total Care or WellPoint. Or they just know they're on a waiver and they don't know that that's Medicaid. For our kids, Medicaid pays for health insurance and health care as a backup to our private insurance. Medicaid pays for prescriptions. Medicaid also pays for respite care. The state agrees that one of my kids needs 17 to 24 hours of care a day. For the first 9 years, my family, including our neighbors, did that on our own. Then, after about 3 years on the waiting list, we started using respite through Medicaid. The respite workers would take my son to the River Bandits game with Nana and Grandpa, feed him and give him his meds, or play Uno with him. And we could better care for our younger son, or just sit down a minute without worrying about meds and feedings every single second. Or his respite workers would take him to visit our friend Ada in Cedar Falls, who's also on Medicaid. Ada is nonverbal, requires help with toileting, constant monitoring for seizures, and assistance with movement. What's going to happen to Ada and her family as the cuts kick in? Now my son is living in a group home, which has been so good for him and for us. And already, before the cuts, there's an 8-year wait list to get on the Medicaid that provides housing. After the cuts, who knows? I did 2 years of AmeriCorps National Service. My father is a Vietnam-era Navy veteran, and my grandfather served in Operation Torch, Operation Husky, and the China-Burma-India Theater. I don't think they served in the military to defend a government of, by, and for the billionaires. We are the richest country in the history of the world. I don't know why we let Republicans waste our time saying that we can't provide health care for everyone. There's enough for everything for everyone, as long as we don't let the rich steal more than half of it off the top.
Thank you so much, Jonna, for sharing your powerful story and for continuing to stand up and to fight for families like yours. Your voice matters now more than ever because we're not going to sugarcoat the healthcare crisis laid before us. If Republicans jam through their extreme healthcare cuts, millions of families will suffer. Families will be forced to pay more for less. Millions will be kicked off of their health insurance, and Americans will still get sick. When Democrats are in power, we expand access to quality, affordable health care, from passing the Affordable Care Act to strengthening Medicaid to lowering the cost of prescription drugs. When Republicans are in power, they cut health care so they can enrich their billionaire friends. That's shameful, and we refuse to be complicit in Republicans' heartless policy decisions that raise costs and make it harder for Americans to make ends meet. And we were elected to make life easier for people we serve, not harder. People like Jackie Bush Holcomb, who is with us here today. Jackie worked hard throughout her professional career to provide for her family and build a good life. But after losing employer-sponsored health coverage, she spent years navigating the healthcare system on her own. Finally, she was able to get coverage through the Affordable Care Act. For families like hers, affordable healthcare has made all the difference. We're here today for those families, for Jackie. Jackie, thank you for being with us today. You're now recognized.
Thank you for having me and giving me the opportunity to tell my story. My name is Jacqueline Bush Holcomb, and I am 59 years old. I live in Clark Summit, Pennsylvania, in the northeast part of the state. In 2008, my career as a mortgage wholesale lender came to a halt due to the festering mortgage crisis. My husband is self-employed as a certified residential appraiser. When I lost my job, we suddenly no longer had health insurance. We obtained insurance coverage for our family, and we paid for the coverage until our premiums became too expensive to afford. In 2014, I needed emergency surgery, but was denied coverage due to a pre-existing condition. We took money from our savings and paid out of pocket over $6,000 for the surgery. I appealed the cost of my out-of-pocket expense for my surgery and waited for a determination. We continued to drain our savings to pay our health insurance premiums. While waiting for my appeal determination, our premiums increased dramatically. We were at the point where we could no longer afford health insurance. And then in 2015 came a godsend, the Affordable Care Act. We have received health insurance coverage from the ACA since 2015. I currently work with my husband in his appraisal business. Our income fluctuates due to the real estate market. We update our income for coverage through the ACA accordingly as we are required to do so. Our annual premium rate fluctuates, and we adjust our budget for coverage as we depend more and more on health insurance as we age. Our premiums are likely to double or even triple because of Republican cuts to the ACA. We will not be able to afford this drastic increase, especially since our other costs like food are going up as well. My husband is 62 years old and I am 59 years old. We cannot afford a sudden increase for health insurance and will have to go without coverage. We are just one American family having this discussion and realizing that we are now taking a gamble with our lives. We have depended on our health care coverage to keep us healthy, and I am thankful to say that we currently are healthy. By forcing us to go without health insurance, Republicans will steal that good health from us. Instead of working with Democrats to find a solution, the Republicans have shut down the government and have fled DC. I am requesting, pleading, and now I am demanding that the Republicans do their jobs and protect the millions of Americans like me who rely on the Affordable Care Act. Thank you for your time. I appreciate it.
Thank you, Jackie Bush Holcomb, and for your very powerful testimony. And again, I want to thank the Democratic leadership of the Policy and Steering Committee for holding this event today. It does show that there are members of Congress who are actually serious about doing their job and coming to Washington. And there's no question that the people of this country are bursting to see real action to make sure that we take steps to protect our health care. Last week, I had a telephone town hall. My district had 10,000 callers who joined in. The second caller was Christine from Coventry, who calculated that the premiums that she and her husband will be paying next year with the expiration of the advanced credits will jump from $3,100 per month to $3,100 per month, and a total annual cost of $37,200. As she said, not only is that unaffordable, it's impossible, and they would fall into the ranks of the uninsured. From Eastern Connecticut today, we have Heather Broth, who's a surgical nurse at Bacchus Hospital. She's been there for 13 years, the quintessential caregiver who does amazing work. She is also the leader of the AFT local that represents the nurses at that hospital. And I've seen firsthand her amazing leadership, negotiating labor contracts And she understands just as well as anybody in this room about the fact that in order to get results, you actually need to talk to each other and actually come up with compromises to, solve issues. She's a mom with 2 kids. We're just talking. She's going to hop on a plane as soon as this hearing is over, go back home, and she's got a shift tomorrow at the hospital. And again, I really want to thank her for being here to talk about the impact of the cuts, the Republican cuts in healthcare in terms of the caring profession and the work that you do.
Much for that introduction. Good afternoon. My name is Heather Brouth. I am a surgical nurse at a small hospital in Norwich, Connecticut, serving patients from both rural and urban communities in the surrounding area. I'm also proud to be the president of our AFT affiliate 5149 in southeastern Connecticut. Today, I'm here to talk about a healthcare crisis that's just around the corner. The reason for it? The big ugly law enacted by Republicans in Congress and the Trump White House. The partisan law slashed Medicaid and allowed healthcare tax credits to expire for working families, all while funding tax breaks for billionaires. While that may be great for those who have money, it's going to make life harder and more expensive for everyone else, including more than 100,000 people in Connecticut who will face higher premiums if the tax credits expire. As healthcare workers, we take pride in giving our patients the very best care because that's what they deserve. But we've long struggled with a healthcare system that's strained, and it's getting more strained. Already, our small community hospital has had one of the busiest years to date. And with cold and flu season ahead, healthcare workers are gearing up for what we're expecting to be the worst respiratory virus season we have seen since COVID in 2020. We have a nursing shortage already. It currently takes months to see a primary care provider and forget about getting an appointment with a specialist in under 6 to 12 months. We have patients sleeping on stretchers in our emergency rooms overnight and on stretchers in hallways while waiting for other patients to be discharged on inpatient units. It's clear that the cuts coming down the pike have the capacity to dismantle and destabilize our currently understaffed and struggling healthcare system. Hospitals and clinics will close or cut essential services, forcing patients to travel further and wait longer for care. Up to 15 million people could eventually lose their healthcare coverage, and millions more will see their healthcare premiums increase. Our communities can't afford groceries right now. How do we expect them to afford significant rate increases to their health insurance? And we know that rural communities will face higher premium increases than other communities if the healthcare tax credits are allowed to expire. Nationally, nearly a quarter of farmers and ranchers get healthcare coverage through plans supported by these tax credits. Entire communities will be devastated if the politicians in charge of Congress and the White House don't take action. The frontline workers are scared. Everyone who's concerned about their own health or a loved one's health should be as well. Asking our friends and neighbors who can't afford food or rent to pay on average more than double out of pocket for their health insurance premiums is going to force people off of their health insurance. But that won't stop people from needing emergency care. Regardless of whether they live in a blue or red community, communities will suffer. People will get sicker, and it is not a stretch to say some will die. But instead of working with Democrats to lower healthcare costs, Republicans shut down the government and took a vacation. Many of our patients are hardworking Americans who are about to receive notice that they're losing the tax credit that allows them to afford healthcare, and Republicans are okay with that. Republicans control Congress and the White House. They should return to DC and do their job. They should end this government shutdown and work with Democrats to rescue the healthcare that's now at risk. Our patients and communities deserve no less. I thank you for your time.
Well, I want to thank our witnesses for being here today and our leadership for holding today's hearing. As a direct result of the Republican healthcare crisis, tens of thousands of my constituents in Alabama are on the verge of losing their healthcare coverage or seeing their premiums skyrocket. They are hardworking Alabamians. Many of them are parents, seniors, veterans, children, and people with disability. They deserve better than what they are getting from President Trump and Republicans in Congress. I am grateful to our Democratic leadership for the opportunity to give them a voice today in today's hearing. Enhanced premium tax credits have made a tangible difference in the lives of my constituents. In fact, of the nearly 400,000 Alabamians enrolled in a marketplace plan, 98% benefit from enhanced premium tax credits. These tax credits resulted in an average saving of $657 per month in Alabama. With those credits applied, the average enrollee's monthly costs were somewhere around $64 a month in 2024. Clearly, these tax credits have been transformational for so many Alabamians who are now able to afford health care coverage. No one knows that better than Dr. Tom Ellison, who is with us today. Dr. Tom, as I call him, is a wonderful physician in Birmingham, Alabama. He's a physician, a civil rights era witness, a lifelong advocate for racial justice in healthcare. He was raised in Birmingham, Alabama, and went to Parker High School, the Thundering Herd. He vividly recalls learning about the brutal attacks on the Freedom Riders at just 11 years old, an experience that shaped his lifelong commitment to justice. A classmate of one of the girls killed in the 1963 16th Street bombing, Dr. Ellison grew up at the heart of the civil rights movement, later being honored in Birmingham during the 50th anniversary of the Children's Crusade in 2013. Today, Dr. Ellison works with Project HELP, focusing on health equity and advocating for better access and treatment for communities of color. He frequently speaks about the ongoing disparities in healthcare, stating that race and bias still shape how patients are treated across the healthcare system. Dr. Tom continues to use both his voice and his medical expertise to fight for healthcare system and making sure that all Alabamians, all people, have access to quality, affordable healthcare, and he does so with great dignity. Again, I am very proud to welcome and hope that my colleagues will join me in welcoming Dr. Tom Ellison, who is not only a great member of my constituency, but is an amazing doctor that has really spent his lifetime helping others. So thank you, Dr. Ellison, for being here today.
Thank you for those kind words. It's an honor and a blessing to be here, especially in a room with people who I've worked with, and I know that actually care about people. They care more about people than policy, and that's why we're here today. When I was young, I got on my motorcycle and did like Dr. Kiley, to go around rural Alabama to see why these people's outcomes were not as good as we had suspected. When I was young, we said that people living in rural areas, they are much more healthy than the people in Birmingham and urban areas. But that was not the case. That was lack of access from everything as simple as an ambulance ride. I can recall when a person was in Hale County was ill and they had no ambulance service. So a person had to drive from Tuscaloosa, Alabama, to Hale County, find the ambulance that was parked at a service station, and then try to find an address when there's no street signs and nothing. So it became incumbent upon me to make sure that I could work with our legislation, our congressional staff, to ensure that all these people had a right to health care and to get quality, good health care. Because we are the largest country in the world that does not provide this universally. And so I've dedicated, as my congresswoman said, to try to make sure that people had access and we reduce the morbidity and mortality that's associated. It can be simply done with preventive efforts. And so that's why I'm here today, to share that story and to recall how much has changed. Our governor appointed me to a 1999 rural health study. And what we found out was that people were not having access, and that's why the outcomes were so bad. So now, after ACA, I visit those same places with people who, for the first time in their life, entire families have access to health care. And during a storm or disaster, when we go in triage, they are better prepared. They know the name of the medicine they were on. They know what type of insulin they use. And they know how they can afford insulin now. And all of this is because of some of the aspects of ACA. Now, again, thank you for allowing me to be here.
Thank you. Thank you, colleagues, for the opportunity to speak this afternoon. I accept everything that's been said by you. For the record, I'm Benny Thompson. I live in a community of 500 people. I've lived there my whole life. We don't have a doctor, but we have a veterinarian. There are a lot of other things that rural America provides that some people take for granted. But healthcare is precious. My district is 300 miles long, 200 miles wide, and it covers 40% of the whole state from a geographical standpoint. I've represented it for 32 years, and I've been honored to serve the people who call this area home. It's important to understand that because of this so-called big ugly bill, the Republicans plot to gut the ACA tax credits for over 15 million Americans who stand to lose their coverage. It's absolutely maddening to see House Republicans on the retreat today and not being here in Washington to work for the American people. If the Republicans' ACA tax credit expire, 81,000 people that I represent will lose their health care coverage. This impact is real. A 44-year-old small business owner in my district pays about $269 per month for coverage. If those tax credits expire, that will cost $891 a month, a 331% increase in premium. House Republicans are showing no urgency to serve the American people. Medical care services in rural America have been deteriorating for decades. In my state, I'm one of 8 states that does not have the Medicaid expansion monies. We've lost $15 billion in monies provided under that program, and my governor still says he's a Christian. So I have to just say whatever because of that. Let me give you a recent scenario. Byron Stribling in Belzoni, Mississippi, lost his wife, Harmony, who was 9 months pregnant. Belzoni is in Humphreys County, a county that today has no hospital at all, and it has not had one since 2013. His wife suffered a heart attack and died on the way to the nearest hospital, which is in Yazoo County. Now, under the big ugly bill, Yazoo County will lose its hospital. So now I want you to understand that's Humphreys County, no hospital, Yazoo County, no hospital, and the nearest hospital past those two counties is 45 miles away. Those are the kind of horror stories that people need to understand. Some of you heard about a mass shooting in Mississippi over the weekend. Well, Delta Regional Hospital is a level 3 trauma center. Now, a level 3 trauma center is just fortunate to be open, to be honest with you. And on that particular night, Delta had a contract surgeon. 6 people died that night. 20 people were brought to that hospital. And the best thing they could do is to get them transported to other areas. Now, 4 helicopters came to the area. Now, and it's bad, but it gets worse because the helicopter ride costs $25,000 per patient. So over and above getting them to a level 1 trauma center, that family or that individual is placed with that cost. So Republicans ought to be ashamed of themselves, putting families in this kind of situation. Democrats get it. That's why we're here working today. But more importantly, is the public needs to understand that those people who are not working on their behalf, they have insurance. So if anything happens to their family while they're out doing whatever they're doing other than their job, everybody's fine. Shame on Republicans.
Thank you, Congressman Thompson. We'll have a few member questions now, starting off with Rep. Teresa Ledger Fernandez. And we're trying to get a few questions in, so short and sweet, members.
But the story I'm about to tell is a different story. On my way to the airport yesterday, I ran into my donor employee, and he said, "Can I tell you my story?" As small business owner, his family of five relies on the ACA tax credit to afford their insurance. In Mexico, it's called BWell. Oh, in New Mexico, it's called BWell. They really need that coverage. Their 14-year-old son recently had spinal surgery, which costs tens of thousands of dollars. If Congress fails to permanently extend the premium tax credits, Jeff's premiums will go from $520 to $2,600. That'd be 50% of their income. That's double their mortgage. In Trump's America, keeping your health insurance costs more than keeping a roof over your head. No small business owner or working family can afford these rising costs. And Jeff doesn't have a sugar-coated solution. He told me, I don't know whether I should drop my insurance, whether I go to one of those plans which won't give me the coverage I need for my family. And sadly, Jeff's story is not unique. My voters are coming up to me all the time to tell me their stories of how hard this is for them. If Republicans showed up in person at town halls in their districts, they'd hear similar stories. Thankfully, in New Mexico, Republicans actually are listening. Republicans joined with Democrats to pass a short-term fix to keep ACA premiums affordable for Jeff's family and New Mexicans, but only until June 30th. I'm calling on my Republicans in Congress to have the same courage that Republicans in New Mexico had. Listen to your voters, stand up for your voters, extend the credits, restore the Medicaid cuts. It's not okay that voters in rural and Republican districts in other states won't have the same protections as those in New Mexico. We want everyone to have access to health coverage at affordable prices. We want everyone to live. Thank you. I yield back.
Rep. MacGyver, you got it?
Thank you so much, Rep. Kelly, for the opportunity. First of all, I want to thank the witnesses for being here today. I am Congresswoman LaMonica MacGyver. I represent New Jersey's 10th Congressional District. And in my district, which is the least wealthiest district in New Jersey, about 200,000 of my residents will see increased costs to their healthcare insurance, but will be kicked off of Medicaid as well. So it's a combination. I want to thank each of you for your courage to come here today to participate in truth telling. It takes courage to do that, to show up here and do that. And so I'm thankful for you coming here to share before us and share before the folks that are here as well. I have a question for both Ms. Higgins-Freeze and Ms. Jackie Bush. It's kind of like not a tricky one, but it's an interesting one. We spend a lot of time talking about what the perfect healthcare system looks like from a elected official perspective. And for me, I know it's healthcare for all, you know, for people to be able to afford it and not go bankrupt, to be able to have access to it. But if you can have one word to describe does your vision for healthcare look like for this country, what would it be with one word to describe such?
In one word, I think it would be universal.
Mm.
Either we're all children of God and deserve healthcare coverage, or we're not.
Thank you.
Words.
I'll allow.
Kind of the same thinking, but I think it would be for us meaning all of us. But also, I have to go back to, why I'm here today. Affordable.
Mm-hmm.
So what is the answer for the affordability for all of us? So
No, that was
sorry.
good. Thank you. Universal and affordable. We'll make sure we mail a copy of both of those words to our Republican colleagues who has not shown up to work in weeks. Thank you. With that, I yield. Yes. Yep. Yeah. Everybody. Yep. If only they can get
Ellie,
that
you know
part.
you're next,
Yeah.
right?
Thank you. Hopefully, from your mouth to God's ears. Thank you. With that, I yield back, Rep. Kelly.
Good afternoon. I'm Kelly Morrison. I represent Minnesota's 3rd District. I want to thank all of you from the bottom of my heart for being here. I echo Rep. McIver's. It is not easy to come here. So thank you for your bravery and thank you for sharing your stories. So it's the 15th day of Republicans holding the government hostage and refusing to hear the overwhelming majority of Americans asking them to protect their care. I've been shocked by how they've decided to ignore patients and advocates, experts, physicians, caregivers, nurses, and so many more. Americans are telling them clearly their policies will harm them. I have the honor of representing the people of Minnesota's 3rd District. And before then, I had the privilege of caring for Minnesotans as a physician for more than 20 years. And I simply cannot allow Republicans to pretend this is something that can be worked out later. They are jeopardizing clinics and hospitals right now. They are endangering access to essential medications and specialized care right now. Their policies are threatening American families right now. And as a legislator committed to protecting the health and well-being of the Americans I was elected to represent, I'm in DC here with my Democratic colleagues ready to act now, not whenever Republicans feel like returning from vacation. Just this morning, House Majority Leader Steve Scalise doubled down on the claim that the Affordable Care Act and premium tax credits haven't, quote, worked for families. And they're supposedly focused, I guess, on better alternatives, were the words he used. So I have a very brief question for each of you. I guess I'd like to hear from you just very briefly, maybe even in one word, yes or no. Would the Republican plan to skyrocket premiums and make health insurance unaffordable work for you, your family, or the communities that you serve? We'll start with you.
No. Capital N-O.
Absolutely not.
Thank you very much. We will continue our fight. Thank you so much for being here, and I yield back.
Thank you, Madam Chair. Hi, everyone. I am Congresswoman Grace Meng from New York. I am also chair of the Congressional Asian Pacific American Caucus, and I am deeply concerned, as all of you are, about the way that President Trump and congressional Republicans shut down the government and left town. They are single-handedly responsible for the largest cut to Medicaid in U.S. history and are now taking away tax credits that, as you've heard and as you all know, take away tax credits that help Americans afford health insurance, raising premiums for millions in this country, including over 1.5 million people in the Asian American, Native Hawaiian, and Pacific Islander community. Thank you so much to each of you for the tremendous work that you do, for the life-saving testimony that you are contributing today. For providers like child clinical psychologist Dr. Lee in California, who works primarily with neurodivergent patients with Medicaid, these cuts will significantly limit the care that she can provide. Families may only be able to receive an evaluation, leaving them vulnerable and feeling helpless when they most often need treatment as next steps. My question is for Dr. Ellison. Doctor, as someone who grew up during the civil rights movement, can you talk about how intertwined the movement towards justice was with expanding healthcare in this country. For example, how have the tax credits disproportionately helped communities of color?
Thank you for the question. It has immensely helped people for the first time, as I said before, be able to have insurance and take care of their families. It's helped small businesses who try to employ people and make sure they are healthy and ready to come to work, insure them with self-insurance programs. And I see the parallel because when I was a child, when we were attacked, no one would see us. We had two physicians, Dr. Hamilton, Dr. Harris, who would treat us in the street. And there was no help from anyone, and there was a lot of despair. But thankfully, like I said, the community I came from came in and helped us and made sure that we were well. I remember one time I was hurt more more than I had been previously, and I finally got admitted to a hospital, and I was put in the basement of the hospital, um, right under the plumbing. And a person came to me and told me, be hopeful because God loves you. I was 12, so I said something that maybe I should not have said. I said, I know God loves me, but could you ask him to send someone to move me from under this dripping water? you know, and so there has been parallel all through the rural areas. I work with Congressman Thompson in rural Mississippi because we're neighbors and we're friends. We share the same disparities. And so when we see what's going on now, it's going to roll back a lot of things that people have had. Uh, at a storm site in Selma, I had a person who finally knew how to access health care because before then they won't dial up and we had to help them get care. So now we're going to tell them we're going back. You haven't had health care before. Now you have it. Your family is healthy. You're able to work. But now we have to roll back. And again, we got to go back to the times where you choose between food or blood pressure medicine. And I don't think that's right.
Thank you so much. I yield back.
Hi. First of all, I'm Doris Matsui from Sacramento, California. And I want to thank all of you for being here today. You've been such wonderful witnesses, and we learned so much, and also feel the same way you feel about how important healthcare is. Republicans' cruel attacks on healthcare are just absolutely relentless. It's absolutely amazing. First, they cut $1 trillion from Medicaid. Then they turn a blind eye while the Trump administration dismantled our public health system. Now they're trying to rip affordable coverage from millions of Americans. And let me be clear, they are not just harming people's health, they are tearing at the fabric of our very economy. Jackie, you and your husband own a small business together, right?
Yes, that is correct. He's a self-employed residential appraiser.
Right. So we're not just talking about your health, we're talking about your livelihood too. Is that right?
Yes, completely.
Yes, because
It's
owning.
the snowball effect that will start at one thing and affect everything else in our
Absolutely.
life
So,
together.
so
And our age is playing into this factor now as well.
owning a small business is really the epitome of the American dream. I have so many businesses in my city, and they really are the ones who drive the economy. But Republicans really want to take that away. And so, Jackie, if you see your premiums double or triple, how would that impact not only your health, but the health of your business?
Well, everything is contingent upon our health. My husband is self-employed. He's 62 years old. I'm 59. So if my husband is sick and cannot work, I am not the certified residential appraiser that lives in the house. He is. So if he were to become disabled, unable to go out on appointments, I'm not qualified to do his job. I'm qualified for something else in the business. So one thing affects the other. And I don't know the specific answer to your question because it's fear of the unknown.
Exactly. But if your premiums rise double or triple, then it'd be hard to pay those premiums, right? And that would exacerbate your situation,
Yes.
right?
We've had the discussion, not knowing, fear of the unknown of what the premiums will be. And our income fluctuates according to the real estate market. So double, maybe we can work it. Triple, out of the question, absolutely not.
Right.
So then the discussion was, well, maybe we'll take a chance and not have coverage.
Well, we understand that situation. I know my small businesses owners understand that too. So we're going to keep fighting.
Thank
Just
you.
keep fighting. Thank you very much. I yield back.
Rep. Conaway.
Good afternoon, and thanks to our leadership for bringing us here and holding this hearing to highlight a very significant concern for the American people. I hail from New Jersey's 3rd Congressional District. I happen to be a practicing physician. I served as a physician in the Air Force. And while I am new to this chamber, I'm not new to the policy issues surrounding healthcare in this country. We have a Republican Party who has, every time they get in power, seems like the first thing they want to do is cut healthcare. They want to grind regular people into the ground and take away from people what should be a right. No one can forego healthcare. When you are ill, when you're sick, when a loved one is sick, you need to have a place to go. When you have hospitals that are now 2 hours away from you or the clinic near you closes, that represents a crisis to those individuals. And people feel this. Now, we're here fighting to preserve American healthcare, and we have a Republican Party with a history of taking healthcare away, and they're not here working. And someone mentioned about the military and being in the service, and I've heard Leon Panetta say the other night, former Secretary of Defense, when we have our people who have served this country in uniform, who have agreed to put their life on the line for our country, there's a lot of courage in that, in service of the country. And all we're asking our Republican colleagues is to have just a little bit of courage, to come in and say, no, they're leading us down the wrong path. We have to go and do the work of the American people. We have to preserve healthcare. My home state, 450,000 people depend on the premium tax credits, the enhanced premium tax credits for their healthcare. 88% of those on that program get those tax credits. Now, what are they going to do when those tax credits go away? Without change, insurance costs will go up for an individual by $1,200. Without change, the cost for a family of 4 will go up by over $4,000. And as we've heard here today, they're not going to afford that. And insurance companies are already baking that into the rates they put forward. Those rates are going up. Why? Because they understand that people are going to forego care. And I've seen this. I've seen people come in with delaying, having bleeding, not coming into the hospital for a couple of months. And now we have a cancer that we can't treat. I've seen this. I've seen people lose limbs, lose vision because they didn't get health care. And we're walking down that same road again. And the Republicans are driving us there, and they're not working. And what makes it worse, 2 things. 1, they're doing it to give $1 billion tax breaks to the wealthiest people in the country. And 2, they're afraid to come to work because they know that as soon as we swear in the new representative from Arizona, that discharge petition, which will force the Congress to vote on releasing the Epstein files, will have to come to a vote, and it will pass. And they don't want to see anything like that under any circumstances because the president and his friends don't want that information to come out. So we're going to stay here on the case. We're going to continue to fight for the American people. People need to know that it would be one thing if we had a party who would negotiate in good faith. But we've already seen this lawless administration make agreements that they then renege on. And so walking into negotiations with them is already fraught because they won't stand behind their word. That's what we're dealing with today. And so, but we're going to keep at it. We're going to fight to try to keep institutions and people at work. Remember, there's a huge healthcare economy. When the nursing home closes, when the hospital closes, people are out of work. What does that do to the local economies? It is devastating when those things happen. People go without care. People go without jobs, and we want to prevent that from happening. And just lastly, you think that you are immune from this because you have employer-sponsored insurance and that you're fine and maybe I don't need to be concerned about my neighbor? When that hospital goes down, that hospital treats everybody, rich and poor. When your neighbor's out of work, that affects the guy selling sandwiches or the person who's got a dry cleaning store in the neighborhood. It drags communities down. Everybody's impacted by it. And so let's all work together to put pressure on our colleagues to get back to work. Let's stop the cuts, lower the cost, and save American healthcare. Thank you for the time. I appreciate it. I'll yield back.
Andrew, you have a question? Yeah. Yeah. We still have time.
Thank you to my colleagues for convening this critically important hearing today. And thank you to our panelists for your testimony this morning. Ms. Broth, Ms. Bush Holcomb, and Dr. Ellison and Ms. Higgins Freeze for taking the time to be with us today. Last week, I was here in this room and shared stories from my own constituents in Oregon's 6th District. And today I look forward to hearing from you. And it is so crucial that we do put a real face to the millions of Americans who could lose their health care as a result of the Republicans' cruel health care cuts. And my question is for Jackie. What we heard this morning, because of your ACA healthcare, you are able to really continue to operate your small business, knowing that you have health insurance. And my question is a two-part. First of all, what portion of your budget it is comprised of healthcare? So of your housing, your groceries, and your healthcare, what portion is healthcare? And then what would it mean for your small business if you lose your ACA coverage? What tough choices will you and your husband be forced to make between your livelihood and your health?
I would say healthcare, give you an average number, 20%. If I calculate and I crunch the numbers, 20%.
So it's a large portion.
That's all of healthcare combined into one. Prescriptions, premiums, so 20%. And then the second part of your question is if we were not to be able to afford our premiums, what would that do to us?
And what kind of decisions would you have to make?
Well, again, we've had the discussion, and this is my family alone, and there's many, many out there having this discussion right now. So it's my husband and myself, and we have had the discussion on not knowing what our premium will be. So if it triples, we cannot afford it. So at that point, I would do my due diligence and shop around and probably get a plan with less benefits, higher deductibles. Maybe I might save money in the premium. It would take a lot of research and a lot of work on my end. I'm starting back at the beginning again, where I was years ago when I lost my job and we lost our insurance coverage through my employer. So it would be devastating for us. So that 20%, we're not in a financial position for that to go up to, 50% of our income for healthcare. 20% right now is expensive for us.
Do you pay taxes?
Yes.
You pay taxes. This
Yes.
this
Yes.
is part of what you pay into. And the Affordable Care Act is not something that is free. We all pay taxes. This is health care that you pay for. This is not a freebie.
We have paid into
the
taxes
system.
since we have been working.
Thank you.
And we will continue to do so,
And you're
whether we have health insurance or not.
and you run a business that pays into your local economy.
That
So
is correct.
thank you. Thank you for running that business. Thank you for supporting your community. And I hope we can continue to afford, and I hope the Republicans come back, lower the cost of healthcare for all of us so that we can make sure that you stay in business, that you and your husband can afford healthcare, that you can remain well, that you can keep working and offer your community the services that you offer now. So thank you so much for being
Thank
here.
you for listening to me.
Thank you to the members, and now I'd like to turn it over to my co-chair, Debbie Wasserman Schultz, and then we'll have more questions later.
Thank you so much, Co-Chair Kelly, and thanks to our witnesses. Really, we appreciate your powerful testimony. These are the stories that the American people really need to hear, because when we're in Washington, D.C., so many times all of these issues get sanitized, and it feels very generic, and putting a human face on the impact of the explosive Republican-forced healthcare cuts is really critical. And sharing the harsh financial realities that so many of our families face right now has never been more critical. That truth-telling cannot be taken lightly. There are entire swaths of Florida's nonprofit sector who advocate for our working families, who would normally scream from the rooftops about a looming crisis like this. Yet for the most part, they've been silent because of the vicious retribution that comes with speaking out against the Trump administration. People who fear losing their health care contact my office every day, yet they're scared to speak out publicly too. This mass self-censorship is rampant because people fear the kind of political retribution MAGA mets out on its critics. They fear a family member or an employer will get fired if they speak out or criticize this president or our governor, Ron DeSantis, or that their organization will have their funding slashed or cut entirely. So what you shared here today is truly vital and courageous, because the reality is that far too many Americans do not get the care they need, all because they can't afford it. So affordable, one of those key words you mentioned, is critical. But no one should have to worry that a doctor's visit could cause them to miss a rent payment, or that paying for medicine means only half a cart of groceries. Republicans are turning America into a country where people get sick or die because they can't afford healthcare. Those are their values. They don't care that millions of Americans are at a higher health risk because of their extreme cuts to healthcare. They don't care that disease will go undiagnosed or vital medicines and checkups will be put off for weeks or months. Republicans just don't care about you or your health. That's why they're not stopping at gutting Medicaid. They want to raise costs and make millions of Americans pay double, triple, or quadruple in healthcare premiums. Hospitals will close, doctors' lobbies will overflow, people will die. And here's our next video.
President Trump's policy bill calls for deep cuts in Medicaid. Patients will be forced to travel to bigger hospitals. Doctors here fear some of the critical patients won't make it that far.
Hundreds of hospitals and nursing homes are closing, and it's making America sick. Republicans cut the funding that kept them open to pay for their big, ugly bill. And now, 338 rural hospitals could close, leaving the sick and vulnerable without a lifeline. Republicans are shutting down the government and closing the doors on our health care. That's why Democrats are fighting back, to protect America's care.
Next up for a question is Congresswoman Rashida Tlaib.
Dr. Ellison, can someone stop having cancer? Because we cut them off of health insurance?
No.
Yeah, can they all of a sudden be healthy? Everything's great. You don't need insulin. You don't need all the, I'm being serious. I think my colleagues are acting like that somehow our residents can stop being sick, can stop needing, or they don't have any special needs or disabilities all of a sudden. They're cured. No one plans to get sick, right, Jonah? I mean, nobody plans to get sick. No one.
No.
You plan your child to get sick? Do you plan on getting cancer? I want to read to you guys. It's really devastating that I feel like my residents, it makes me actually want to cry, that they're begging me. The fact that they're begging their own government to care about them as if it's their fault to get sick. This one wants me to know that her and her husband have health issues not related to lifestyle. Why? Because I have colleagues that actually try to blame them for getting sick. She said, my husband is a non-drinker. I drink rare occasion. We both have never been smokers, but we both have cancer. And she goes on to say, my husband's a retired public school administrator. Yeah, we can't do it. She said, all the new plans increase cost of copay, medication, co-insurance. She goes on and on. Another one is as a husband, and this is a quote from them, because I like to bring the district here, because there's such a disconnect here of really the pain at home. My husband and I both work for ministries and nonprofits. We spend our time seeking to serve other people and are grateful to have the lifestyle despite the financial challenges. But we have known seasons in the past when high cost of healthcare meant that we were forced to defer treatment for digestive problems, for new glasses, right, Doc? I mean, people get carpal tunnel. They just don't come in because they can't afford it. The plan we have, they said, through the healthcare marketplace, as it stands today, has helped us attend to our medical needs so we can go on serving other people. If the healthcare costs go up, we'll be right back in the zone of being unable to get the care we need, making it harder for us to serve community. And if I may, this is really just heartbreaking. This person said, this year my employer eliminated my position. I had amazing health care. I now rely on a plan at the Affordable Care Act marketplace, which doesn't cover much, but I have something. I'm a senior citizen and going without health care is not something I want to do, but without the subsidy, I have no choice. Mike Johnson needs to get a grim reality check, as it is him and the Republicans that are causing the shutdown. We can't rely on them to deal with it later. Remember that. Again, it's not like somebody can get it, stop being sick. They said we can't rely on them to deal with it later because it would be nice to know how much our healthcare is going to be. Maybe he should go to his district and listen to his constituents. I'm sure they're not happy with him either. And I read after the other, but the one that kind of really breaks my heart is, I rarely get really young people to email me, or, I get the direct messages, sometimes. But this one was heartbreaking. She said, my father is on a fixed income and has been permanently disabled his whole life. She said, these funding cuts have put him and our family at risk of losing health care coverage. On top of that, she said, our living expenses have skyrocketed to the point where we have to pick and choose which bills to pay each month. We're always uncertain of whether what we will get will be enough to pay for our food for the next month as well. She says, I'm 18 years old. I'm already working too, but it's not enough to support my family, myself, an 18-year-old having to worry about this. I mean, I don't have much to say, but I wanted to get this on the record. We're having this hearing because they're not creating spaces for us to hear from families in our district. And, Doc, I started with that because I feel like there is this almost blame or acting like somehow our neighbors that get sick are disposable. Right. Let them die. Let them get sick. Who cares? Let their quality of life decay. And I'll tell you over and over again, even where we know some of the cuts to, Medicaid will not happen until the next year. We know people are making those decisions now, though, of how to address them. But we had people call my office, crying because they canceled their appointment, thinking it's already in effect. Cancel their appointment. This is going to be devastating because people are going to be like, I can't afford it. And they're going to stay home. And they're rather just going to get sicker and they're not going to be able to take care of themselves. This is incredibly, again, shameful for many of my colleagues who, on the other side, many of them have access to healthcare right now, but majority of their families at home, many of them, again, I have about 38% Medicaid recipients. Some of my colleagues on the other side, over 60%. I can't even imagine how their residents must feel. Doc, I know for me, Medicaid, I think of Black maternal health crisis. I think of infant mortality in my community. And when I look at over 40% of births are covered from Medicaid in my state, that's postpartum, that's prenatal. You know this. I just don't think my colleagues get it. It's not like they can stop being pregnant, no, really, at the moment, if they're having birth, it's not like, okay, well, I'm not gonna, it doesn't make any sense to me that, again, we're creating an environment. I know, I'm so sorry. It's just really sad that we continue to have this, and I'm really pleased, and so thank you to my colleagues for allowing this space for me to bring the stories of my constituents here.
Thank you, Congresswoman Tlaib. Congressman Mike Thompson from California.
Thank you, Madam Chair, and thank you, the witnesses, for being here today. I want to just reiterate something that our colleague, Congressman Conaway from New Jersey, a doctor himself, said. He said when the Republicans take control of the Congress, the first thing they want to do is cut health care. I just want to point out that they've outdone themselves this time because they cut health care to give a huge tax cut to their billionaire buddies, people who don't need a tax cut in this environment. And for the past 3 weeks, Speaker Johnson has refused to call back his Republicans to this House to work at a time when people across the district, across the country, people from our district, 30,000 people from my district, are getting these notices from their insurance companies that their premiums are going to shoot through the roof. They open these letters and it's instant sticker shock. And the calls that I get to my office are why? Well, the why is pretty simple. It's because the congressional Republicans are on vacation. They need to be here in these chambers working with Democrats to make sure that we can mitigate these incredibly astronomical cuts that are increases that folks are going to see. In my district, a family of four making $129,000 will pay $14,444 more, a 161% increase. A 60-year-old couple making $82,000 a year will pay $23,788 more, a 526% increase. Nobody can afford that. Think about that. A 526% increase, a 161% increase. These aren't just numbers, they're not statistics. These are things that are going to impact real people. It's going to hurt their ability to pay their mortgage, to buy their groceries, and it's going to impact their savings accounts. Savings accounts gone overnight because the Republican Party is not working with us to mitigate this problem. Heather, I have a question for you. You are a nurse who has experience working in rural areas. I have at home an incredibly wonderful wife who is a nurse working in rural areas. And I'd like to know your thoughts on two things that my wife, my district, and my constituents are facing right now. One is we just got word this week that one of the hospitals in an area that's already medically underserved has pulled back their plans to expand their facilities to be able to offer services to more people. And because the Republicans are on vacation and not here, we're not able to extend the telehealth coverage that Medicare patients are able to use in order to get their health care. And in rural areas, it's a double whammy for them because it's further that they have to travel. One constituent called me and said without telemedicine, she has to pay $100 each way for an Uber ride to get to her provider. Can you comment on that?
Initially, right, that's not sustainable. Like you can't expect someone to be spending $200 just to get to and from an appointment, right? So then they have the copay on top of it, and then whatever the actual treatment is that they're going for. And some of these patients don't have the luxury of time, right? So take, for example, someone who could potentially be having a seizure, right? They could get into their car and drive down the road and crash into you if they miss an appointment, or into anybody that's sitting in this room, or into any one of the Republicans that's on vacation right now. Everyone is at risk when people and their health are devalued and demoralized, right? So the hospitals that are staying open will see a deluge of patients. So hospitals that are already potentially understaffed and underfunded are going to crumble, right? Some hospitals right now are literally sitting on two tectonic plates that are just ready for that one good hit to knock it down. And this will do that to a litany of hospitals across the country. And it's not just going to hit rural or urban, it's going to hit them all, and it's going to hit hard.
Thank you very much. You know, what's happening here is pretty apocalyptic. This is going to hurt a lot of people. The answer is pretty clear. Mike Johnson can bring Republicans back and we can negotiate a response to this, a solution to this. Easier, the president of the United States can pick up the phone, make one phone call and end this.
Yep.
Thank you, Madam Chair. I'll yield back.
So next up will be Congresswoman Joyce Beatty.
Thank you, Madam Chair. And let me just say thank you to all of the witnesses for what you're doing here. I stood on the Capitol steps and heard you all earlier today, and thank you for that. Uh, Doc, let me go to you. And I think it's important for the American people to understand why this is so important and why we're in our 15th day of the shutdown, because we're saying no health care, no vote. And what that means to the millions and millions of hardworking families every day. So can you briefly, because I know we have other questions here, share with us how Medicaid or Medicare or the Affordable Care Act has been important to the work you do in saving lives of hardworking Americans who have benefited because Democrats fought hard to get that affordable care. Just tell us what that means.
It's very important because it allows the people to have access to quality care. It allows them to have a primary care physician who can follow and maintain their health records. If you recall, prior to this, people are going to go to the emergency room for health care. There's no continuity of care, no history of prescriptions. At times, people are prescribed things that are contradicted to them because they have no history of their knowledge. And so what I see is, going back to what Representative Tlaib said, this is a caring and compassionate country. Americans are, when they feel it's deserved. I think what has happened, we've got the term underserved confused with undeserving. So people feel they're not entitled to it because they don't deserve it. You know, people have got confused underserved with undeserving. And so if they think you're undeserving, they don't care whether or not you have the care or not. I recall a brief story in Georgia. A young father, someone stole his car. He didn't have enough insurance to replace it. So he walked 12 miles a day to work just to keep his insurance. When it hit the news, people started a GoFundMe page for him, and he got $23,000 in 2 days because he was deserving, because he was willing to go to work. And I've been at 6 or 7 programs this year. Of course, Representative Horfels have been there just explaining the need and being accessible so people can explain. So if we can make them understand that everyone is deserving of proper health care, that'll help us a long way.
Councilwoman Beatty. Next up is Congresswoman Sarah McBride from Delaware.
Thank you very much, Madam Chair, for convening us. Thank you so much to all of the witnesses for your experience and your expertise that you're sharing today. Right now, tens of thousands of Delaware families are staring down a 1-2 punch, a Republican shutdown and a Republican healthcare crisis that would send healthcare premiums skyrocketing. Let's be clear. These avoidable premium hikes are a Republican tax increase by another name. And they are a tax increase on everyday Delawareans to fill the piggy bank that Donald Trump is using to pay off billionaire donors who are facilitating his abuse of power. In Delaware, nearly 46,000 of my constituents rely on premium tax credits to afford coverage, an average of $588 a month in savings, totaling more than $320 million a year in savings for families across my state. That is what is at stake in this shutdown. Take a retired couple in Sussex County. Right now, they pay about $77 a month for coverage. In the healthcare crisis we're barreling toward, that will jump to $206 a month. That's $1,500 a year just to see a doctor for a retiree on a fixed income. A middle-class family of 4 in Middletown, Delaware could see their yearly health premiums jump by over $10,000. These families can't afford for us to wait to solve this health crisis. But Republican politicians are painting this as a Sophie's choice. So we have to pick between keeping premiums from skyrocketing or paying our federal workers. That is a false choice. We can do both, and we must do both. There's no reason we can't keep this government running and address skyrocketing healthcare bills at the same time, because treating people with respect means keeping the lights on and keeping healthcare premiums low. When I sought this seat, I said I would work with anyone to deliver for Delaware, and I would stand up to anyone who was hurting Delaware. We remain here at the negotiating table, ready for Republicans to do their jobs. But they shouldn't think for a second that I or my Democratic colleagues won't fight to defend people's health care every step of the way. And as Ms. Holcomb mentioned, we are fighting for healthcare for all. Healthcare for Democrats, Republicans, independents, healthcare for people who voted for us in the last election, and healthcare for people who didn't vote for us in the last election. Because we are here to serve everyone and to fight for everyone. And with that, Madam Chair, I yield back.
Thank you, Congressman McBride. Next up is Congressman James Walkinshaw from Virginia.
Thank you, Madam Chair, and thank you all for being here and for your courage and sharing your stories. Ms. Higgins-Freeze, I was particularly moved by your powerful story that you shared this morning about your family's challenges and the role that Medicaid has played in your family's journey. I was a little bit confused, though, because I've heard from my Republican colleagues that the big ugly bill contained no actual cuts to Medicaid. It just cracked down on waste, fraud, and abuse. So I guess my question for you is, have you and your family been engaged in fraud in the Medicaid services that you've accessed?
That I think there's a terrible problem with waste, fraud, and abuse. Billionaires are not paying their fair share of taxes. Another example of waste, fraud, and abuse is that the Supreme Court has been accepting ridiculous gifts that state employees whose gift laws cap them at $2.99 find absurd. And the president is taking gifts from foreign governments. So I think there's a terrible problem in this country with waste, fraud, and abuse. I will also say there is waste, fraud, and abuse perpetrated by the government in its administration of the Medicaid programs. 2 years ago, my family, out of the blue, received a notification from the state that my son's Medicaid waiver allotment of respite care each month had been slashed. However, they did not notify us in a timely fashion, and we had to fire all of our respite workers with 4 days' notice. And when we tried to appeal it, first, it was difficult to find out what the appeal process was. I was told during that process that another family in the community had experienced the same thing, but that mother was quite ill and said, I know I should appeal this, but I don't have the energy. Fortunately, I had the energy. I tracked down the process for how to appeal it and was given an appointment with an administrative law judge. And then my husband spent an afternoon calling over 30 attorneys trying to find someone who would represent us when we went before the administrative law judge, because I have no legal background. And they all said, no, we don't know anything about this. We do Social Security law. We do things for the VA. We don't know anything about how Medicaid works. I can't represent you because it wouldn't be ethical. And finally, I burst into tears in talking with one of them. And I said, look, what do I need to sign as a waiver? Because how is it ethical for me to go in there as a mom of 2 kids with absolutely no legal background and represent myself, and not ethical for you, who's at least been to law school and understands how to read the code, to go with me? And this person, thank goodness, said, okay, I'll go with you. So I called the folks who were arranging for the administrative law judge, and I said, I have an attorney. Please add this person to the Zoom appointment. And within 12 hours, the state did a quality review and discovered that not only should our respite allocation not have been slashed, we had always, for the past 6 years, not been getting as much respite as our family needed, which we told them. So there's a tremendous amount of waste, fraud, and abuse that's perpetrated against families that are on Medicaid and by the billionaires in this country.
Thank you. Thank you for sharing that aspect of your story as well. And I think it highlights a big piece of the Republican agenda here, which is to make life so difficult, so hard for working people to access the services and the programs that they've paid for, that you give up. And what we have seen from Donald Trump and from Republicans here in Washington is an agenda to pick the pockets of working families and line the pockets of their billionaire donors. So thank you for sharing your story, and we're going to continue to fight to cancel the cuts, save healthcare. Thank you. I yield back.
Thank you, Congressman Walkinshaw, and really, Jonathan, thank you so much for just continuing to share more facets of your very impactful life experience. Okay, next up is Congressman Stephen Horsford from Nevada.
Thank you to the co-chairs and to Leader Jeffries for holding this important hearing and to all of our witnesses. Your voices, centering your voices is incredibly important because unfortunately, our colleagues want to make this about everything but the American peoples whose healthcare we're fighting for. Look, I didn't come to Congress to cut healthcare. I came to create more opportunities for the people that I represent in Nevada's 4th District. And my district actually covers 50,000 square miles. It's not just Las Vegas and North Las Vegas, but also central rural Nevada. And I really appreciated Dr. Ellison, you referring to the underserved doesn't mean undeserving. And that is so incredibly true, especially in our rural communities where they already struggle to get access to care. Ms. Baruth, you spoke about this and earlier today and again during your testimony about the challenges that people in rural America face in getting access to healthcare already, and how both the cuts to Medicaid, along with some of the transportation and other barriers, the workforce shortages, contribute to the challenges that they already face. And I just heard earlier today, this administration apparently found $40 billion to bail out Argentina. But to be clear, extending the enhanced premium tax credits for 1 year cost $20 billion. So they found the money to bail out Argentina. They found the time and the money to give tax breaks to billionaires like Jeff Bezos and Elon Musk, but they don't have the time and don't have the respect to call the House back into session so that we can deal with this Republican healthcare crisis. So can you explain, based on your experience, Ms. Baruth, what are the biggest challenges that rural communities face, especially rural hospitals? I have 2 rural hospitals that are expected to close in Nye County, in the center part of Nevada. We don't have a birthing center in Pahrump. There's very limited OBGYN services. Families have to travel more than an hour and a half to deliver a baby. And that's if they even have access to transportation and some of the other issues that you noted. And how would a spike in premiums next year deepen the problems that are already being experienced in rural America?
Well, a spike in the premiums is the easy part to answer because people are going to die. They're going to drop off their health insurance. They're not going to go to the hospital. They're going to stay at home. They're going to get sick and they're going to die. And that's the simple answer to it. Because we already have patients that are coming into the hospital that have been waiting and unable to afford to come in and get treatment or have surgery or get chemotherapy for their cancer because they're already struggling financially. This is going to be a massive catastrophe of epic proportions for the healthcare system. When it comes to our rural communities, I think of people like my father. My father is an ex-Marine and an ex-police officer. He was shot in Vietnam. He came home and was a recipient of a Rifle Expert Medal and a Purple Heart. And he lives in rural West Virginia. And a few years ago, he was riding a motorcycle, which I told him since then he is no longer allowed to do. A dog ran out into the road and he rolled his motorcycle. And he had to be life-starved to North Carolina for treatment so that he could be intubated, sedated with a chest tube and get better. These are already real issues for people who live in rural areas. Go ahead and shut down their closest hospital that's 50 miles away that they're already struggling to get to. Where are they gonna go? They're not. They'll be lucky if they make it to the parking lot and have a heart attack and die in the parking lot.
Horsford, and just for the members that are in the queue, we have about 30 minutes left. So if members can keep their questions or statements short, that would be helpful. Next up is Congresswoman Emily Randall from the state of Washington.
Thank you, Madam Chair. As everyone here knows, we are on day 15 of this shutdown that's impacting families and our communities. And meanwhile, Speaker Johnson and our Republican colleagues refuse to even negotiate extending the ACA's enhanced premium tax cuts while open enrollment begins in just 2 weeks. And families are making their decisions about their budgets and their healthcare coverage. In my district, families will see their healthcare costs rise by an average of $1,510 due to the big ugly law. And for a family of 4 earning $64,000, costs will jump by $2,571 if they're receiving the tax credit and all of a sudden don't. I don't know any family making $64,000 who can absorb that kind of increase in their budget. Families who are struggling to afford rising rents, families who are struggling to afford rising grocery prices, who are working hard to pay rising energy costs, all because our Republican colleagues refuse to take action to lower costs and protect healthcare for people. Ms. Holcomb, I know your family relies on the ACA tax credits, as you've already talked about. And Speaker Johnson and House Republicans claim that there's plenty of time to figure out the future of these credits, that they don't expire till December 31st. This can be a December problem. We can worry about it later. Can you explain to the Speaker and his Republican colleagues why waiting until December 31st to extend these tax credits is way too late, and what that delay would mean for families like yours who are already receiving premium notices?
Well, I think my answer to the question is with the expenses increasing, life changing dramatically as far as food costs, as far as utilities increasing. There's been a lot of changes over the last couple of months, and there's a lot less money, especially in our home. So I have to plan accordingly, just like a lot of other families have to do right now. You have to do things differently than you used to do. You have to look at the big picture. And 2 months is not a long time from now. And I budget. I dot the I's, cross the T's. I have it down to a penny. And a lot of people do the same thing that I do when you're working on a budget. That's how it works. But I can't work with a budget when I don't know what is going to happen. So I can't wait to figure it out come January 1st when I get my health insurance bill and it's $2,200, because then I have to start dipping into our life savings that we worked really hard for. And we didn't work hard for it for health insurance. We did that so that we could enjoy life as we're older. We've worked really hard.
So much.
Thank you.
I think there's a lot of stories like yours that it feels like our Republican colleagues are just not listening to or aware of. I don't know what world they're living in, but every person in my district is struggling with affordability and the cost of healthcare. Thank you for sharing. Madam Chair, I yield back.
Thank you, Congresswoman Randall. Congresswoman Bonamici from Oregon.
Well, for being here. Really appreciate your telling your stories. We're here in the Capitol today, in the nation's capital, waiting for our Republican colleagues to show up, to get back here to do their jobs, to save healthcare, to end their shutdown, to lower costs. They seem to be missing and completely out of touch. The American people deserve a government that works for them. And we're just not seeing that right now. They seem to be oblivious to what's happening. I don't think Donald Trump has ever struggled to pay for health care or housing or childcare. And he hasn't struggled. But I know that Oregonians are struggling, too many of them. And now they've already made massive cuts to Medicaid in the big ugly bill. Now they want us to lock in a policy that will increase costs for people paying for their insurance through the exchange, that means millions of people will see their costs increase. About 198,000 Oregonians, including my constituent Teresa. She's from a rural county, Clatsop County, Oregon. And like you, Jackie, she gets her insurance through the exchange. She runs a small farm, wonderful farm. I've been there, produce and flowers. And last week she got a letter saying that her health insurance premium is going to go from $230 a month to $1,077 a month. That's more than $10,000 a year she does not have. So what is she supposed to do? It's unconscionable, it's unacceptable, and it's unnecessary. You know, she's about to turn 60. I know you said that too, Jackie. She's at a time where she's, running this farm, which is a challenging job, even in a strong economy. But she doesn't know what to do because one illness or injury could threaten her life and her livelihood. She doesn't want to close the family business, but she's not alone. And we know that. There are many people across the country who have that same story, and they're getting similar letters. And I tell you that their costs are already high: childcare, housing, grocery. Teresa and everyone in the United States should feel secure and not fearful when they get sick or injured. So I want to ask you, Ms. Broth, will these Medicaid cuts and premium tax credits, ending the premium tax credits, will that only affect people who are on Medicaid or people who get their insurance through the exchange?
Absolutely do not think so. It's going to affect a wide berth of people. And I don't even think that it's difficult to try to get someone like Donald Trump to understand the fathomability of how horrendous this is going to be, because it's just not, he has no frame of reference.
Exactly.
There's no frame of reference. He has no lived experience that translates and correlates to what people are trying to get him to understand. And when you just put blinders on and shut everything down and take your ball and go home, it's easy to just sit, right? If you're not there, you can't listen.
Yeah, the Republicans need to get out there and listen to their constituents, because they're going to hear stories like you are telling us today. And I tell you, it's just outrageous that there are people across the country who are facing this decision. So I thank you again for being here. We've got to stop the cuts and the shutdown, lower costs, and save healthcare. And I yield back.
Thank you, Congresswoman Bonamici. Next up is Congresswoman Norma Torres of California.
Thank you so much for the opportunity to be here with all of you today. And thank you to all of you, our panelists, for flying to Washington, D.C. and doing the job that Republicans seem to be unable to do. We're here today because they have refused to come to work. They have been on a 4-week vacation. They're refusing to listen to our working families and shutting down the government rather than working to lower the health care costs for all of us. This week, more than 30,000 of my constituents on covered California will get notices that their health insurance will double. And on top of that, nearly 340,000 of my constituents may lose or see cuts to their health care because the $1 trillion in cuts to Medi-Cal that Trump and Republicans made in their big, ugly bill. You know, these Republican cuts are going to affect everyone, every single person, everyone's health care, not just those on covered California, not just those poor people that they seem to not care about. Doctor, I have spent a lot of time doing town halls with our seniors, trying to prepare them, talking to them about the timeline of that big, ugly bill, and asking them to touch base with their doctors now and don't wait until next year when seniors under the age of 65 will have to provide certification from their doctor that they are unable to work. Can you tell me how are doctors going to be able to handle that that number of people that will come to them asking for specific certification in order to meet the demands of this Republican priority bill?
Well, we will work extended hours, try to get additional staff to meet the needs of the people. But as you suggested, it rains on the just and the unjust. And so when people don't have insurance and they start clogging up the emergency rooms, the person with the best insurance in the world will still have to wait their turn to be seen and have another negative outcomes. So I think that their physicians will do all we can. There are physicians like a Dr. Ford who goes once a month to rural areas, but that's a Band-Aid. She goes once a month, sees people, take medications to them because they have lost some of their insurance already. So when these things continue, we're going to have to increase things like health literacy so that people can know they still need to come in if they don't have the money or the copay.
The medical personnel across the country have been warning us that our hospitals, our clinics will close, that services are going to have to be cut, longer wait times in the ER, fewer doctors and nurses. But instead of being here working this out with Democrats, they choose to continue to be at home. This is unacceptable. And again, I want to thank you for finding the courage and the heart to be here with all of us and talking about the stories, your personal stories, and the stories of your patients back at home. Thank you so much. And with that, I'm going to yield back to the chair.
Thank you.
Councilwoman Torres. Next up is Representative Becca Balint of Vermont.
Thank you so much. And thank you to all the witnesses for being here. It really matters that you're here. Look, I just want to bottom line it. You cannot cut $1 trillion from the healthcare system, which is what happened in the big brutal bill. You cannot suck $1 trillion out of the healthcare system and not impact people. And I represent an overwhelmingly rural state of Vermont. We're already having a difficult time keeping rural healthcare facilities open. Rural people have worse health outcomes than folks who live in the suburbs, who live in urban areas. Higher rates of chronic disease, higher blood pressure, diabetes, heart disease, cancer, stroke, injury-related deaths. It's already bad. And now they're going after the ACA subsidies that enable people to get health care. And I always say to my constituents, I don't care who you voted for. I don't care if you like me. I'm still going to show up and fight for your health care. And that's the piece of this that is so craven and cruel, that in rural districts across this country, their representatives are not standing up for them. And Ms. Browse, I want to thank you for being here and all the work that you do. Tell me, in your vast experience, what is it going to look like in rural America for those patients when they're trying to get health care after these cuts go through?
I mean, how many of them have any kind of an underlying chronic condition that they take any kind of medication for whatsoever? Because if they take even a blood pressure medicine and see a cardiologist, it's going to go to the wayside. It's not going to happen. And the closest hospital that they would go to if they have a cardiac event is likely going to close. And then they're going to need to be life-starred to a level 1. And then in transit, what will happen? Nothing good, right?
Nothing good.
Nothing good. So if they're actively having a stroke, then that person becomes potentially paralyzed. And then why don't you start tallying up the healthcare that goes along with that?
Yeah.
So we see patients in our hospital that everything from stabbing and gunshots to farmers who have their mechanical equipment roll over on them with crush injury.
That's right.
So we see them all. We need to stabilize them, determine whether they're appropriate to stay in our hospital, and if not, life-star them out.
Yeah.
They get on a helicopter and they go. So what if we close?
That's right.
Then what?
Yeah, that's exactly it. And so look, it doesn't have to be this way. It really doesn't have to be this way. And all of the nurses and the doctors and everyone that is speaking out right now, I want voters across this country to think about it. Who do you trust? Do you trust the nurses and the doctors who are showing up for you, who are raising the alarm? Or are you going to trust the people that rolled over for the billionaires so they could have a tax cut while you're getting screwed over? Thank you. I yield back.
And next is Congressman Troy Carter from Louisiana.
Thank you very much to our co-chairs and to Leader Jeffries, and certainly thanks to all of you for having the courage to come and to be with us, to share your knowledge on what this means to so many Americans. Medicaid plays a crucial role in providing care for millions of Louisianians, and ACA tax premium credits help make marketplace coverage more affordable for individuals and families that are ineligible for Medicaid. It's essential that we continue to both strengthen Medicaid and permanently extend the ACA enhanced premium credits. It makes a difference. These programs are lifelines for children, small business owners, veterans, seniors, people with disabilities, and hardworking families. If Republicans let these tax credits expire, 43,000 people in my district alone will see their health coverage costs skyrocket at a time when the cost of rice and bread and rent and mortgage and other payments continue to escalate. This is yet another burden that in America, the richest country in the world, we should not have to suffer. Democrats are here to fight for you in word and in deed. And we thank you for taking time out of your schedules to be with us. There's a million questions I'd like to ask. There's a million statements I'd like to say. I'd like to open my heart and give it to you. We know that time is limited and there are other members to be heard. So I'll be very brief, but I do want to ask Dr. Ellison and Ms. Broth the same question. When a person decides that because of the stress and strain of being able to afford health care, and they elect to not see the doctor because they can't afford to, or they elect to skip a dose of their insulin or their medicine, what does that do, A, to them, and B, to the system that ultimately, when I don't see you in a clinic, when I don't see you on the preventive side of care, I see you in the emergency room and I see you on the curative side of care. Share with us briefly what that means.
Let's take a diabetic, for example, because I feel like this is a tangible, realistic example, right? So if someone who is diabetic does not take their medications, they run a litany of risks, everything from seizures to cardiac events, but also they developed wounds, right? So untreated diabetes can lead to peripheral neuropathy, which is numbness in your extremities, and then you don't have sensation, and the smallest cut or insult to your tissue could cause an open wound that then festers into a sore that then turns into either an amputation or hyperbaric treatment or death from sepsis. So something as simple as making sure that people have access to their medications when they need them in a timely manner, and making sure that they have the education about why they're important and the sequelae that can follow if they don't follow through on a regimen that's recommended.
And so if we can drill into the real issue is, if you can't afford it, you can't take it. If you can't take it, you get sick. If you get sick and it's untreated, you die.
But all of this is preventable.
That's the point. It's preventable, but you have to have access.
Correct.
And we have to convince people that preventive care is a heck of a lot cheaper than curative care.
Oh, yes. Insulin, I can tell you, is definitely cheaper than someone who needs hyperbaric therapy or an amputation or multiple wound debridements.
And for that person who elects to not take their medicine because they can't afford it, then they end up in the emergency room. What does that do to the system?
Well, the emergency rooms in hospitals are already wildly overcrowded. So it just bogs the system down more. And then that person just not having gotten a dose of insulin, right, or multiple doses of insulin over time, let's say, might prevent the next person behind them from getting treated for a cardiac arrest or something else, right? So, and then the
Domino
next person, and then the next person, and then the next person, and the wait times are longer, and the people aren't getting in fast enough. And then again, people are going to die in the waiting rooms.
And then quickly, I'll yield. Dr. Ellison, you said earlier that even with the best health insurance, it won't shorten the lines if the system is strained, even the best insurance. So people were sitting at home thinking, well, it doesn't impact me because I've got the best insurance in the world. It doesn't matter. When the system is strained, it impacts everyone.
Yes, and to follow up on her scenario with diabetes, that person can also have a stroke from the not having diabetes. Then the burden on the hospital system, if it's a rural hospital, is more expensive uncompensated care. And so that's going to put a strain on everything. And the person, like she said, may eventually die or be paralyzed or need artificial limbs. So let's give them the insulin. Let's give them the access early so that they won't have to worry about the strokes and all this stuff and the uncompensated care.
Thank you all very much. Madam Chair, I yield.
Order. Next up is Congressman Frank Pallone from New Jersey.
Thank you, Madam Chair. I think I want to ask my question of Ms. Halcomb, because I heard what you said this morning at the press conference. What I want to stress, and my question relates to it, is the fact that people will end up not having insurance. You know, when I talk to my Republican colleagues, they're missing in action, they're not here, they're on vacation, whatever they're doing. But when I talk to them, they don't seem to understand the importance of the Affordable Care Act and the importance of these enhanced premium tax credits, because in their minds, and you know, they say this to me privately, they think there are other options. You know, that somehow people are going to get private insurance, or they're going to get some, you know, something else, you know, to as an alternative. And I try to explain to them that you may be opposed to the Affordable Care Act, some opposed to it altogether. You may be opposed to help with these subsidies or tax credits, but you have to understand that the reason we did the Affordable Care Act, I was the chairman of the Energy and Commerce Health Subcommittee at the time, and I was one of the drafters, is because we found that there were getting to be more and more Americans every day that could not find health insurance because it was too expensive. They didn't get it on the job, or they got it on the job and they couldn't afford it. They, you know, they were self-employed, they were a farmer, you know, and that's what this was meant to deal with, this gap, right? And we did the enhanced premium tax credits because we found out that if we didn't provide more help at a little higher income, then there'd be even more people that would go without health insurance. So what I would just like you to answer the question, explain why we're not talking about higher costs that are going to result necessarily in higher pocket. That's true too, because in New Jersey right now, a 60-year-old couple making about $80,000 a year is going to be forced to pay an extra $15,000 more. So obviously, the cost is going up. But we're talking about people just simply not being able to get health insurance. So that, if you understand my question.
I do understand your question, and I think that what it boils down to is, let's just say, for example, a 60-year-old couple. They've worked hard, they've paid their taxes, they've paid in, they've saved money. We have to now dip into life savings that we have saved, we've worked hard for, to pay higher insurance premiums. So, you know, looking back before the Affordable Care Act came, I did my shopping. I did my research. I shopped and I found best package that I could afford. I checked out deductibles. I checked out, you know, prescription coverage. It was a lot of work. And then my premiums kept going up. And I had the discussion with my husband. This is getting out of control. We can't afford this. And at that point, the Affordable Care Act came out. And it was a godsend for us because we were able to qualify based on our income. Our, you know, we're paying taxes and then our net income, you know, versus our gross income. And we were able to finally get something that was affordable and it was fair. I felt like we were getting very good coverage, not supreme, but decent for the price that we were paying. But to double or triple being self-employed, we will not be able to afford it. We will dip into our savings, and then that will be drained eventually at some point. Who knows the answer? We don't know because we don't even know what our premiums will be.
Thank you. Thank you,
Thank you.
Madam Chair.
Thank you, Congressman Pallone. Next up, we have Congresswoman Deborah Ross from North Carolina.
Thank you, Madam Chair. My question is for Ms. Higgins-Freeze. I represent a lot of parents in North Carolina who have children with disabilities, who are on Medicaid. I've visited with many of them. I've been to special places where their kids go to school. I know you talked a little bit about where one of your children goes. And in North Carolina, we want to build a new state-of-the-art children's hospital, but that's now not going to be able to happen if we don't get Medicaid money for that. And what I've experienced with my constituents and the people I visited is that disability doesn't have a political party and it doesn't have an income level. It's just something that families together try to help their kids with, and that Medicaid can really be a lifeline for their family. Could you talk about the financial difficulties that you would have if you didn't have access to Medicaid? And can you talk about what this big, ugly law is going to do to your families? I've heard that families are going to have to get recertified every year for a variety of different things. They're not sure how to do that. Tell us what this means to you and your family.
Medicaid makes our family's life possible. I mentioned this morning that one of my kiddos has been determined that they need 17 to 24 hours of care a day. And we don't know what these cuts mean for Medicaid. Right now, he's living in a group home. Medicaid pays for part of that. Social Security pays for part of that. We could fully fund Social Security if everyone who makes over $400,000 a year paid their fair share. But we've decided not to do that. And so we don't know what that looks like, because the way it works in a group home is that it takes Medicaid, Social Security, and SNAP benefits to make it work for kids to live in and adults to live in a group home. We don't know what that will look like or whether it will be possible for him to continue living in a group home. And if that's no longer possible, that would be extremely, extremely difficult for our family. We were struggling before he moved.
And do you know, are you in conversation with other families that are seeing this the same way, that this law really is going to upend both your child's care, your family's finances, and just your whole family situation?
I think there's two answers to that. Monday night, I had dinner with a group of other moms who have kiddos with disabilities. And the questions that they were asking were, what does this mean? And the answer is, we don't know, but it's not good, right? Longer and longer wait times for care already. As Heather mentioned, it's often 6 to 12 months before you can get into specialty appointments. It's very, very difficult to access care even as it is. But the flip side of it that I think it's very important that you all hear is that, especially in the places that have privatized Medicaid, I would re-emphasize that there are hundreds of thousands of families who don't know they're on Medicaid. And so when the messaging is constantly Medicaid's going away, they're like, that's fine, I'm not on Medicaid, I'm on WellPoint, I'm on Molina, I'm on Iowa Total Care. They don't know that that's Medicaid, or they say, that's okay if Medicaid goes away, my kid's on the waiver. And they don't know that those are Medicaid waivers. And so I think the messaging has to be very crisp and localized to what people understand when you say Medicaid.
Thank you so much, and I yield back.
Thank you, Madam Chair. You know, I'm an only child, but I'm married into a big family. And when we first were married, my husband was constantly going to this event, to that event, to a christening, a graduation. And I said, you know, we both worked in government, and I said, I can't keep up with this. You know, there's always a place to be. And my husband said to me, you always inconvenience yourself for family.
Mm.
And I just want to thank you for being here today because you have gone out of your way because you give a damn, not only about your own families, but about your neighbors, about our communities, about our human family. And our destinies truly are tied. So I thank you so much for your expertise, for your candor, and for your vulnerability. My questions have been asked and answered, but I do just want to talk a little bit about the district that I represent, the Massachusetts 7th. This is a vibrant, diverse, dynamic district, deeply unequal in a 3-mile radius. You might find this hard to believe. From Cambridge to Roxbury, the blackest part of my district, life expectancy drops by 30 years. So we have disparate outcomes across all avenues, but especially when it comes to health. And in fact, my district has already lost 2 hospitals, and Kearney Hospital and St. Elizabeth's. And 1 in 3 of my constituents receive their care from a community health center, which is patient-centered, culturally competent, all of the things. And of course, they're all vulnerable in this moment. I want to share an excerpt from a letter of one of my constituents, Sasha, who lives with type 1 diabetes in Boston. It's the idea of Medicaid being cut or made harder to access terrifies me. I don't know how I would survive. I'm only 18 and I want to live with purpose, help others and give back, but I can't do that if I'm not here. And I can't stay here without the care that keeps me alive. Madam Chair, I ask unanimous consent to enter this letter into the record. Medicaid is a lifeline for Sasha and millions of others throughout the country. It's not a nice to have, it's a must have. And instead of protecting access to care, Republicans have chosen cruelty. They passed the big betrayal bill and created a healthcare crisis that endangers the lives of every person who calls this country home. Donald Trump, RFK Jr., Republicans in Congress are dismantling our healthcare system by firing workers at public health agencies, defunding research for cures, denying women essential reproductive care, and attacking science. And now families are just weeks away from skyrocketing hikes for health insurance. In my district, a family of 4 making $64,000 a year will pay $2,500 more in premiums each year. So for a 60-year-old couple earning $82,000, they'll have to pay an extra $14,000. More than 35,000 of my constituents are at risk of losing their coverage altogether. None of this is acceptable and 100% preventable. Republicans could work with Democrats to lower these costs, but instead they chose to shut down the government, continue their campaign of wholesale, widespread hurt and harm. I do not know if it's incompetence. I do not know if it is greed. I do not know if it is outright contempt for the American public. But let me be clear. We are fighting for you. To every person fearful of losing life-saving health care, know that we see you and we will not stop fighting for you. Thank you.
Next up is Congresswoman Mary Gay Scanlon of Pennsylvania.
Thank you, Madam Chair, for bringing us together. And thank you to our witnesses for sharing your really compelling stories. What has struck me in listening to them is how they reflect the stories that my constituents shared at an event convened by faith leaders in Philadelphia just a couple days ago. We heard from Lori, a small business owner who gets her insurance through Pennsylvania's marketplace. Her adult daughter has a disability and relies upon Medicaid. Lori and her husband are both cancer survivors whose cancers were discovered early because they had health insurance that provided for regular checkups. But in order to stay healthy now, they need to have quarterly follow-ups for the next several years with specialists. If the ACA credits lapse, their premiums are going to skyrocket from $1,000 to almost $2,000 a month, plus a likely extra 80% increase when the 2026 rate hikes kick in just over 2 months. We heard from Andrea, another small business owner who has diabetes. She currently pays $700 a month for coverage, but without the ACA credits, it would be $1,400. She just got her premium notice and expects that her cost next year will be $1,600 a month. If that happens, she's afraid she's going to have to close her business and try to find a job someplace that has a group health plan, a loss of both her dream job and to the community that she serves with her business. We heard from Max, an ER doctor who worked for a frontline hospital, which closed recently. We had 4 hospitals in my district close in the last couple years because of bankruptcy, and due in part to inadequate Medicaid funding. He spoke of the impact on our community when a hospital closes and people can't get emergency care when they need it. He said people have to travel farther for less care, and sometimes they don't even make it. We're already hearing about a rise in births in ambulances because people can't get to a hospital. We heard from Lafayette, a certified peer specialist who helps people in recovery. For more than 2 decades, he was trapped in a cycle of addiction and deteriorating physical and mental health. Like so many others, Medicaid provided the lifeline for him to recover from addiction and lead a productive life in our community. And the headline is that all of these stories, and unfortunately your stories, are not unique. They're happening to people all across America. Americans' healthcare is at risk because of the crisis that Republicans have created here. If Congress doesn't extend the Affordable Care Act's enhanced premium tax credits and allow the big ugly bill's Medicaid cuts to, and allows the big ugly bill's Medicaid cuts to move forward, millions of Americans will lose the health coverage they depend upon. And whether you get your health care through Medicaid or Medicare from the ACA exchange in your state or a private insurer, we will all feel the effects of the Republican policy choices that will close hospitals and health centers and nursing homes. We will all see increasing costs and longer wait times at the ER and when we need to see a doctor or specialist. So this is unacceptable. The impact is going to hit all of us. So I want to thank all of our witnesses here in DC. I want to thank my colleagues for holding this hearing and standing together to demand that House Republicans return to DC and help Democrats make sure that all Americans can get the health care they deserve. So thank you.
Thank you.
Thank you, Congresswoman Scanlon. Next up is Congresswoman Betty McCollum from Minnesota.
Thank you, Madam Chair. I do want to thank the witnesses today, and I want to thank people from all over this country who are sharing very personal stories of what's happening with their bodies and what's happening with their families' incomes. Thousands of my constituents have reached out to oppose Republicans slashing trillions of dollars from Medicaid. In my district, 19,000 people are expected to lose their Medicaid coverage. Hundreds more have sent me messages concerning the end of the Affordable Care Act credits, like Allison in St. Paul, and I quote from her, "If this credit expires, my effective health care costs would increase substantially, putting additional strain on my household budget at a time when my family, like many others, are already struggling with costs." I held a roundtable where some small business owners shared their stories about healthcare coverage for families and their staff. Dan, who's been selling toys in St. Paul for more than 27 years, co-owns Mischief Toys with his wife and daughter. They're already facing tough increased costs due to Trump's tariffs. And now they're staring at a 20% hike in health insurance costs. And yes, I did say 20%. This increase would have been higher had it not been for Governor Walz, the DFL, working with Republicans to establish a reinsurance program in Minnesota. Dan and his family are gravely concerned about how their family's business is going to survive and just how they're going to survive with pre-existing conditions. So my question is for Jackie and excuse me for being so informal. You shared so much, Ms. Holcomb and Ms. Frizz, if there's time. How will the cancellation of the ACA credit impact, and you've already kind of said how it'll impact you, but so many of the other people that you've networked with, either you started sharing with families, with children with disabilities, you as a businesswoman, you're going to have to make compromises. So what kind of compromises are you hearing others make in conversations? One compromise I know that my constituents were telling me If they're lucky, they'll pay more for less coverage if they're lucky. Would you both just kind of elaborate in a minute a little more?
So I'm back to the drawing board. I have to do my research. And again, I can't plan my budget without knowing what my premium is. Is it doubling? Is it tripling? Is it going from what it is now to, who knows, $3,000? So I'll have to shop around. And, you know, my husband has his own business. I work with him, you know, at almost 60 years old, you know, can I go out and seek employment and get insurance through an employer? Is everybody going to be doing that because they're losing their coverage? I can't plan for my future when I don't have the truth and the facts of what is going to happen. So I'm trying to answer your question.
You are.
But I can't because I don't know.
You
I
and so
think
many.
I speak for a lot of people that have a story similar to my family's.
That's right. You don't know.
I have
Can't
no
plan.
idea.
I think that when I think about compromises, and what kinds of things our family and others like us would have to compromise if the cuts to Medicaid aren't rolled back, I think about that the promise that we've always made to our kids since they were born is we're with you till the end of the line. And when they were little, their doctors made a commitment that they didn't just want them to survive, they wanted them to thrive. And we've always tried to live by that in our family. And so when I think about the Medicaid cuts, for one thing, we've pretty much kind of set aside the notion that we'll ever be able to retire if the Medicaid cuts stand. We just imagine that we'll have to continue working as long as we can in order to pay for as much as we can for especially our kiddo who lives in a group home and has some pretty significant special needs. So that's not, saying, oh, we think about not retiring. I mean, that's not like a lot of people that, like Ms. Broth was talking about, where they're not going to get their insulin tomorrow. So I recognize that. But I guess what I would say is, I don't understand why I'm having to make this compromise in order to give money to billionaires. I just don't get it. That really is not why my grandparents served during World War II, was so that we could have government of, by, and for the billionaires, and their grandkids could have their Medicaid taken away.
Thank you. Thank you both. Thank you, Madam Chair.
Much, Congresswoman McCollum. Next up is Congresswoman Castor from the great state of Florida.
Thank you, Madam Chair. Good afternoon, everyone. American families are simply bracing for these astronomical cost increases to their health care. And this comes at the worst time. They're already grappling with higher grocery bills and electricity costs. In Florida, we so rely on the Affordable Care Act. We have over 4.7 million Floridians who go shopping in healthcare.gov, the marketplace, and choose the plan that works best for them. And most of them get a little bit of help through the tax credits. But I want to share the story, one story of a gentleman. I learned all the details this weekend. It's not from my district. He's from a Republican district on the other side of the state in Daytona Beach. He was, his name's David. He's 61. He was diagnosed with pancreatic cancer just a few months ago, and he's started undergoing chemotherapy. A little bit of good news, his cancer markers with the chemotherapy are down, and that's hopeful, especially when you're talking about pancreatic cancer. But he said he has a Florida Blue policy. I'm taking your advice to name what the insurance is of Florida Blue Cross and Blue Shield. And he anticipates that it's going to be cost him 40% more. He's self-employed, doesn't have a high income. But with 40% more, there are going to be people like David who will not be able to continue their treatments. And I wonder, Ms. Bruppa as a nurse and Dr. Ellison as a doctor, what happens to someone like David? What can people anticipate when the costs go sky high and they have to make really tough decisions?
Well, I mean, in addition to it being harmful to the economy to take money from them and put it towards increased costs of healthcare, they aren't able to contribute to their community in the same way. But also, when someone like that is going to be required to pay that much more for their health insurance, it's going to force them to make very difficult and inappropriate decisions that they should never have to make. Groceries or health insurance, mortgage payment or health insurance, car payment or health insurance. And then when you take away housing, transportation, and all the other amenities that he may require to live and be a viable, productive member of society, you strip him down to nothing. Why is that fair? That's not fair. He deserves better than that. He deserves to be able to afford healthcare and also be able to afford living a comfortable life. That's what the American dream is all about. That's what living in America is supposed to be. Living a comfortable, productive, happy, and healthy life.
And it will depend upon the stressors. People underestimate the health effect of stressors on the individual. There's already enough stressors from the pancreatic cancer. Then he has to worry about his family. Will I sacrifice my health so they can continue? Or like she said, the mortgage. And so there'll be some physicians who will still see him, maybe a community health center that will enroll him for a sliding scale fee, but he won't have the option to get the best treatment. And that's the sad thing. If you can't afford it, they won't give you the best treatment. They will give you options C or D. And so we have to find a way to rectify that so that no matter what your income is or your status, you still get the best care available for you for what particular disorder that you have.
Thank you very much. I yield back.
Thank you, Congresswoman Castor. Next up is Congressman Mark DeSaulnier from California.
This idea that you could pull part of the health system affect everybody. The CFO of two hospitals is regularly amongst the 20% test who are dying tighter. He told me if this were infected, it has to go to the So Dr. I want to get your response to, in our area, we have changed the prevention in primary care. I was in a county hospital recently, disproportionate share hospital, awful stories. So we're going from that system that you have been integral to disadvantaged people, to a system that we were working better at preventing higher acuity so people go to the emergency room. With this system, our emergency room doctors are we're going back 30 years and everybody's going to be showing up, everyone, including disadvantaged. So could you respond to that? Just from a purely financial perspective, this is for a party that says they want more efficiency. Could you respond to this?
Unfortunately, some of the hospitals are going to market-based strategy just to survive. And some, especially the private-owned hospitals who have shareholders who are deciding whether or not the people can be seen and again given the proper care. And now we have AI saying that this person's worth is not worth the cost of the treatment. So people are doing that. So we got computers now saying, well, they won't live long enough for us to recover the cost of caring for them. So let's not even care for them. And so they will send them somewhere else under the guise of a consultant just so to get the cost and everything off their hospital.
And this
And
is a
that's sad.
country, and this is a country that has the highest cost health care system in the world of developed countries with the worst outcomes. So we're
Yeah.
going to make it worse and less efficient.
Yeah.
Thank you.
Congressman DeSaulnier. Next up is Congressman Paul Tonko from New York.
Thank you, Congresswoman. Across the capital region of New York, which I proudly represent, people are receiving notices that their healthcare premiums are about to significantly increase. Republicans are okay sitting back, doing nothing and letting these people paying hundreds or even thousands of more for their health insurance. That's simply unacceptable. And how did we get here? As many know, Republicans currently control the presidency, the Senate, and the House. It's their job to keep the government running. They have failed at that job, and now the American people are paying the price. Instead of putting forward a budget that reins in Donald Trump's lawlessness and addresses the healthcare affordability crisis, Republicans have put forward a dirty partisan spending plan that does nothing to address rising costs for average Americans. If this Republican plan passes, hundreds of thousands of people will lose their health care and millions more will see their costs skyrocket. Current estimates show Americans would see their out-of-pocket premiums increase by some 114% if Republicans refuse to act. More than 10,000 residents in our own capital region that I represent would see their health care costs go through the roof. A family of four earning $64,000 a year, for example, would see their annual premiums rise by more than $2,500, or a 426% increase. On behalf of my constituents in New York's 20th District, I pledge that I am with you and am here to fight for affordable health care. I've heard from countless constituents who are concerned about their well-being and the health of their loved ones. Suzanne, that I represent from Guilderland, New York, wrote to me and said, and I quote, "Please do not allow healthcare costs to rise. This would be a hardship for my children who are already struggling with high costs. It would also affect my grandchildren and myself." Well, Suzanne, I hear you. And with your family and others like yours in mind, I'm standing strong against these Republican price hikes. I stand strong with our guests like Jonna, Jackie, Heather, and Dr. Tom. During my time in Congress, Republicans have voted over 60 times to repeal Affordable Care Act and try to take away affordable health care from our families and friends. Well, I'll note that in all that time, I haven't heard one mention about providing for a replacement. Repeal with no replacement. That's cold-hearted. Republicans claim they don't know how we'll afford extending the ACA tax credits, but they had no problem permanently extending tax cuts for the wealthiest individuals, billionaires, and companies. And just today, Secretary Bessent said they found $40 billion for Argentina. That's $40 billion with a B for a political crony. But somehow they can't find any money for healthcare, a basic right for Americans. Something's wrong with the situation here, and I join you in the fight, and thank you, and I yield back.
Thank you so much, Congressman Tonko. Now I'll turn it over to my co-chair to help close us out with the last few members that have questions. Congresswoman Nanette Barragan.
Thank you. Thank you. Our next member is Congressmember Lucy McBeth.
Thank you so much. I really want to say to all of you that are on the panel today, thank you so, so very much. Really appreciate you taking the time and effort to be here. And in particular, the three of you that gave such heart-wrenching testimony today in our press conference, cannot thank you enough. I don't really have any questions for you today because each and every one of you have spoken such truth, painful truth to power. And I just can never thank you enough for being the face of what is about to happen here in this country and for just really your honesty and your sincerity. And I just can never say thank you enough. But what I will say is that on November 1st, millions will log onto the ACA marketplace to see their costs for next year completely skyrocket. There will be complete sticker shock for many families already operating on shoestring budgets, as you have already indicated, dealing with stagnant wages, all while the cost of their groceries and their child care continue to rise. And I might add that I represent the state of Georgia, and we have no expansion of Medicaid in the state of Georgia. So for the red states, states like mine, the devastation will be untold.
While Democrats are here in Washington, my colleagues, we are here in Washington to stand up for those families, our House Republicans are still on vacation. The livelihoods of the American people are absolutely at stake. I heard from Stacy in my state of Georgia, a constituent who, after being mauled by a dog as a child, she now lives with a chronic pre-existing condition. And I understand pre-existing conditions because I myself am a 2-time breast cancer survivor. Thanks to the ACA credits, she is able to get consistent treatment and keep a steady job for the very first time in her life. She writes, and I quote, "Now my premium will likely go from $600 a month, which is already difficult for me, to over $1,000 a month. And I'm scared I will not be able to afford health care, which will impact my ability to keep my job and provide for my own family." End quote. What's happening here in Washington is personal to my neighbors and my constituents and the families that I represent in Georgia. And it's personal to me. As I stated once before, I am a 2-time breast cancer survivor. So I know what it's like to have a life-changing diagnosis. I know what it's like to be told when you have an illness or a disease that can possibly take your life. I know what that's like trying to figure out, how am I going to pay the bills for my health care? Am I actually going to survive? Am I going to have to rob Peter to pay Paul? And when I was diagnosed with breast cancer, each time I was a single mother. I was very fortunate to have good insurance. And it gave me the peace of mind that I needed. And it allowed me to focus all my strength on getting better, feeling better, and being with my family. But not every person in this country has the ability to be able to do that. I want that same peace of mind for my constituents and for every American who gets sick. That's what they deserve. It is your right. It's not a privilege. It is your right. But if these health care tax credits expire, what happens to Stacy? What happens to all the Stacys across America who have nowhere to turn? What happens if she can't afford the care that she needs? What happens to her family members who rely on her paycheck to keep a roof over their head? Those are questions that our Republican leadership will have to answer, but they're refusing to answer. But we will hold them accountable, as you must as well. Thank you, and I yield back.
Thank you, Representative Macbeth. I want to thank the witnesses for their willingness to stay. You could see this is a very passionate issue. It's so important. We have 3 members left in the queue for questions. So thank you for your time and your patience in sharing your stories. I will now call on Representative Gabe Amo.
I'm grateful to be before this distinguished group of witnesses because of the contributions that you've made and continue to make amidst this Republican shutdown. And I want to be very clear to all those tuning in, all those present who are aware of this fact, but we must say again, the Republicans made a choice. They made a very, very clear choice to have a shutdown over addressing the healthcare crisis that they created. So in both circumstances, they created the situation that we're in. And your leadership, your work, your collaboration with the great fighters and champions that I get to work alongside in Congress, the people in our communities who stand up for healthcare, the voices of our constituents that we elevate every single day, that is going to make the difference. That is going to resolve this Republican healthcare crisis, this refusal to extend the ACA tax credits that people across this country, 22 million people across this country depend on, including 40,000 Rhode Islanders. Rhode Islanders who are in a range of life circumstances, from being on health insurance on their own for the first time to small business owners who I got to sit with yesterday in the district who are being forced to make hard choices, many of whom aren't even drawing an income from their businesses, keeping them afloat because they know how much they mean to the community. To those pre-Medicare adults who are just looking to get the care that they deserve, just hoping, crossing their fingers that nothing bad will happen if they can't have essential health insurance. So amidst the shutdown, I wanted to highlight something that is important, has been raised to me by so many individuals, so many groups recently, that seniors and individuals with disabilities who rely on Medicare, especially those without reliable transportation or who can't afford rising gas prices, depend on telehealth and telehealth appointments to get the care that they need to stay healthy. And when Republicans shut down the government, they let these telehealth flexibilities expire, ripping away critical access to care for people in my state of Rhode Island, people across the country who cannot easily make in-person visits. And I've heard from so many of my constituents that they're facing this double whammy of a healthcare crisis and telehealth flexibilities from going away. And so, Heather, I wanted to ask about your perspective in particular. As we are in this Republican shutdown, how are these vital telehealth protections for older Americans and those with disabilities being affected? And certainly as we have these cost increases, as we have the challenges from the big ugly law, give me your perspective on telehealth.
I think 5 years ago, at the start of COVID, nobody really thought like telehealth wasn't a thing. COVID changed the dynamic of the ability to access care from a periphery. So telehealth gave people who maybe hadn't sought care an opportunity to, or maybe were lacking in their ability to continue care, to get health care. So when you cut off that, right, you make it difficult for people to get to a hospital to get care. The closest hospital is getting shut down. The telehealth is getting shut down. You're shutting down the suicide hotline. So you've got an added layer of issues of things. It's just stripping people of their ability to be healthy in this country. And that shouldn't be something that people wake up each day and think, am I going to be able to be healthy today? Like, am I allowed to be healthy today? Like, can we just allow people to be healthy?
Thank you.
People want to be healthy. Let them.
Thank you. Thank you. We are going to try to keep members to 3 minutes because we have 2 members that showed up right after I made that last statement. I have Representative David Min.
On my mic here. Thank you, Madam Chair, for holding this hearing. I want to thank the witnesses for your very powerful stories, which I think really are emblematic of the stories that people are starting to realize around the country that are going to be their stories. And I'm a freshman. I just got elected last year. This is my first year in Congress, and I've watched over the last 9-10 months as the other side has rammed through extreme legislation, including the misleadingly named One Big Beautiful Bill, which had nearly $1 trillion in cuts to Medicaid. And that is going to happen in 2027. Millions of people will lose their health care because of that. And the rest of us will see much higher premiums. And I think what the Republicans did not realize when they passed that bill is that a lot of those impacts are going to start taking place immediately as insurers, providers, and others start to budget out and think through what this means for them. So, I've heard stories already of pretty massive increases. I think we're expecting something like a 50% increase in our premiums, and we're a pretty healthy family. I have a constituent in my district who's got a lot of chronic illnesses in her family. Their copays have already doubled, and their medications have tripled in cost. And so I guess first just wanted to ask you, Ms. Holcomb and Ms. Freese, the ACA is estimated to increase costs by something like 5% on average. We've heard stories, including from you, about how this might increase much more, 600 to maybe 2,000, 3,000 in some cases. What does that mean in a practical perspective if you or your friends or neighbors or loved ones have to face thousands of dollars in increased premiums each month? For Ms. Freese and Ms. Holcomb. Let's start with you, Ms. Holcomb.
I believe it's not just my family that is in this position. I think it's going to take a wear and tear on the psyche of many families across America. I think that we're already scared and fearful as it is. And with us all experiencing the lack of proper medical care because we can't afford it, I think that will snowball into something that won't be healthy for us.
And there's certainly families not as well positioned as the two of you that might just lose access to care.
Absolutely. And
Ms. Freese?
So your question is around the impact of the Medicaid cuts?
Yeah, having thousands of dollars in increased premiums just on a practical level for your family and others that you know.
So to clarify for me, my family is not on the exchange.
Okay.
So Medicaid is the primary impact to us. And the impact there is around my son's group home, around health insurance premiums, around access to doctors and access to medication, and all of that would be financially devastating. But I think the more important point is that I would urge us to think bigger and more clearly. Medicaid is a Band-Aid on a bad system that has a million different parts where we have to talk about the ACA and Florida Blue Cross and all of these things. And that's the costs of it, and how the little tiny details work aren't the point. Either God sees every sparrow that falls and numbers the hairs on our heads, and that's true for everybody, or it's not. And we've always had one party in this country that thought that some people were better than others. Let's be honest, it used to be the Democrats. Now it's the Republicans, and by their deeds you shall know them. They think that the billionaires deserve to have care, and we don't. And it's not about figuring out how we're going to fix the ACA or how we're going to fix Medicaid. If someone wanted to, you could induct all of us into the military today, give us all honorable discharges tomorrow, and now we're all going to the VA for our care, which is the most efficient and best outcomes in the country.
Something we're working on, And Ms. Brouth, just one final question for you. On the related question, when you take ACA together with the cuts to Medicaid, if this shutdown continues and the Republicans continue to push through a funding bill that does not address the 15 million Americans that will lose their health care, they let the ACA health credits, tax credits expire. What does that mean as far as the quality of care available to average Americans?
The potential to become non-existent. There would be a lowering of a bar for the level of care that people should be and will be expecting. And unfortunately, that will become the norm and not the exception.
Thank you very much. And I'm going to urge Mike Johnson here, open up Congress. Let us get back to work. Let us fix this, end the shutdown, and not abandon millions more Americans to not being insured. With that, I yield back.
Thank you. I call on Representative Tim Kennedy.
Thank you very much. First, I'd like to thank each and every one of you for being here today and your work on a daily basis and your extraordinary testimony. I want to thank Leader Jeffries and the Democratic Caucus leadership for working with the steering and policy co-chairs Wasserman Schultz, Kelly, and Berrigan for making this hearing possible. As the son of a nurse and the grandson of a nurse and the only occupational therapist in Congress, I've seen firsthand what access to affordable health care means to people's lives. It's the difference between independence and instability, between dignity and devastation. And every day across this country, patients are working hard to recover from illness, injury, or disability. People trying to get back to work, to care for their families, and to live full lives. So when Trump and congressional Republicans gutted healthcare on the big ugly bill and are now allowing healthcare tax credits to expire, they're not just cutting dollars, they're cutting lives short. We know this. Facilities are closing, costs are increasing, and access to care is dwindling. The stories I've heard from people back in my district make it clear, and the stakes could not be higher. Whether that's Iris, a mom whose family goes to the neighborhood health center in downtown Buffalo and who doesn't know how she's going to continue to make ends meet, or Andy, a long-term care resident at a nursing facility in Western New York who stood with us just last week, who receives the care he needs with the support of Medicaid that's on the chopping block, or Anissa, a patient at the family planning clinic on Main Street in Buffalo, who's been going there for years, who trusts the staff, who believes in their care, and now that care is threatened because that facility is slated to close in less than a month because of the Medicaid cuts that happened in the big ugly bill. Their stories, sadly, we know, are just the tip of the iceberg. If congressional Republicans cared as much about healthcare as they did about cutting taxes for their billionaire donors, the federal government would not be shut down right now. Democrats are here. We're in Washington, ready to reopen the government, but we're not going to do so at the expense of Americans' healthcare. Healthcare in the United States, the world's richest nation, should not be a partisan issue. It's a basic human right, one I've dedicated my career to fighting for and providing, and one that right now, Democrats are united to protect for the people of this great nation. It's time for Republicans to do their job, to return to Washington, to cancel the cuts, to make life more affordable for Americans, and to protect healthcare for the American people. I want to thank all of you again for being here, for your testimony, for your work, and for all that you do in this fight. The stakes, again, couldn't be higher, and your voices are making a real difference. I appreciate your attendance and your participation today.
Thank you. I now turn to Representative Joe Neguse.
Well, good evening. First and foremost, I just want to say thank you to these witnesses. I understand you all have been testifying and listening for going on almost 4 hours now. And I want to, and Pennsylvania, I'm just very grateful for your service to our country in a variety of different ways and for your willingness to be engaged in this fight right now with us here as we try to explain to the American people the stakes. I also want to say a note of gratitude to Chairwoman Barajan, because she has, of course, shown great leadership in terms of leading this steering and policy hearing. And this may be the longest hearing in the history of the Steering and Policy Committee that she's presided over. So we're grateful to her. I have a question for you, Ms. Holcomb, but I want to maybe provide some broader context before I ask you the question. Martin Luther King Jr. once said that of all forms of inequality, of all the forms of inequality, injustice in health is the most shocking and immoral. Dr. King's words could not have been more prescient. And it strikes me that he could just as have easily been describing current day America. With a Republican Congress that just a few short months ago passed tax cuts for billionaires, the richest Americans in our country, and are now on week 4 of a paid vacation. Why? Because they refuse to do anything to lower the healthcare costs of the American people and to address this healthcare crisis that they created with their draconian cuts to Medicaid, as was referenced. It's shameful. And I've spent a lot of time in the last couple of weeks, in particular, thinking about the countless Americans who are getting these notices now in the mail regarding their ACA premiums. This month is Breast Cancer Awareness Month, as many of you, I suspect, know. My wife is a survivor of breast cancer. A year and a half ago, she was diagnosed with breast cancer. And she is an incredible, courageous woman who battled this terrible disease. We have a 7-year-old daughter, a 2-year-old son. And because of her courage and the health care that we have, she was able to beat that disease. I think about the countless Americans right now, countless Coloradans who are on the exchange and who are about to receive notices. Perhaps they have cancer. Perhaps they have a terrible disease, health challenges that are facing them that they're trying to grapple with. And they learn that their premiums are going to go up by 300%, that they're going to be paying more for health insurance than their mortgage, which they cannot afford. It's immoral, plain and simple. And I've heard these stories. Just Monday, this week, I was in a restaurant in Gun Barrel, Colorado, wonderful part of my district. Small business owner who introduced herself. Her name is Leslie, and shared her story. She pays $600 and some odd for their health insurance on the exchange, her and her husband. Wonderful small business that they run, a diner. And they got a notice that their insurance is about to go up to $1,900 a month because of this, the tax credits expiring, which Republicans refuse to address. So the question, Ms. Holcomb, is I imagine you hear from a lot of clients, from folks in small businesses and others who are trying to prepare for this impending disaster. What do you say to them? How do you help them understand the consequences of?
Are you referring to, does your question pertain to our appraisal business?
Yes.
Okay, because my husband is a certified residential appraisal, but this should be interesting. I don't deal directly with the client. My husband does not deal directly with the client. There's a middleman, usually they're called AMCs, but he does visit the homes, whether it's for a refinance or for a purchase. So our whole business is centered around the real estate market, which we're going to see some changes there because you're obviously going to see people desperate to take the equity out of their homes.
Exactly.
To pay for their health insurance premiums.
Exactly.
It's their biggest asset. So refinancing, cash out, put that money into an account to pay your health insurance premiums. But I think the biggest problem is for everyone, not just my family, for many other families, is it's unknown right now. So yeah, we're getting notices. I'm getting notices, but it's not saying your premium is going to be this. It's saying your premium is going to increase. So we don't know any of the answers, and we should know, especially for the last couple of weeks, the government is shut down. So, and what is plan B? So if there's an increase to our premiums, then what's our other option?
Yep.
But we've been waiting for it, so I guess we'll continue to wait.
So well said. And thank you, as I said, for your testimony.
Thank you.
And I say to all of you, you have far more courage than, unfortunately, our Republican colleagues on the other side of the aisle who refuse to show up here. You all have. We're grateful to you. Thank you. Thank you, Madam Chair.
Sure, thank you. And now we turn to Congressmember Melanie Stansberry.
Right. Good afternoon, everyone. I know it's been a long afternoon for all of you, and I so appreciate you all being here. I was able to hear your testimony at the very beginning, and also for those of you that spoke this morning. So I represent New Mexico's 1st Congressional District, which includes Albuquerque, which is the largest metropolitan area in New Mexico, but by national standards, we're just a 2-cow town. And we've got about 10 rural counties in my district. I'm a native New Mexican. I grew up in a low-income family. I grew up without health insurance. And I think that for a lot of people, probably that our doctor and our nurse serve here, and some of our other representatives here know well that when people do not have health insurance, even when they're on Medicaid or other forms of assistance, they don't get health care. They don't get health care because they're afraid to go to the doctor. They're afraid of encountering bad news. They know that if they go to the emergency room, they're going to be stuck there all day and that they might still not have an outcome. And then they're going to get thousands of dollars billed to them. And so I grew up that way. Still to this day, I didn't have health insurance until I was an adult. I still don't like going to the doctor, even when I know what something is wrong, because I was raised in a home where you just didn't do that unless it was an absolute emergency. And that is how people die, because they don't find out that they have preventable diseases. They don't find out that something is going on with them, and they don't get the care that they need. And so, you know, in New Mexico, we already have a healthcare crisis. We are a state that has about 2/3 of our population that's on Medicaid and Medicare. One of the highest rates of uninsured individuals, although we do have expansion, and we have incredible leadership in our state who have tried to address the healthcare crisis in the last several years. But we also have a problem with basically the business model of keeping our doctors and nurses in state. And so we have like the twofold problem of people can't access healthcare, and we also don't have practitioners. And, you know, Nurse Broth, I wanted to ask you, our nurses have been through so much the last few years, especially with the pandemic and now facing everything we're facing. And then doctor, I want to ask you some questions as well. Tell us about what this current crisis means also for nurses and doctors and healthcare professionals, and how it will impact the people who actually provide healthcare to our communities.
I mean, I can honestly say that since COVID, people aren't exactly running to go work in hospitals anymore.
Yeah.
We saw a mass exodus from bedside nursing care, and younger nurses just aren't really interested in going into a hospital and not being able to deliver excellent quality care to their patients. Then they're coming in and they're lasting a year, and then they're moving on to something that still they can use their nursing degree, but doesn't require them to go in and do a half-assed job, when in reality, all they want to do is go in, and you go into nursing, you go into this profession because you want to take care of people and you want to see them get better because of things that you helped them with. You want to see them not come back to the hospital again. You want to see them thrive, and you want to see them be healthy. And this is destroying nurses and doctors' ability to do that.
Yeah, and I think this is something that folks really, really need to understand. It doesn't matter if you're on the healthcare exchange. It doesn't matter if you're on Medicaid or Medicare or not. This is an everybody problem, because when they take $1.5 trillion out of the healthcare system between cuts to Medicaid, cuts to Medicare, and the millions of Americans who are going to lose their health insurance, it will decimate the healthcare system, literally. And it's already a mess because of what we've been through. And doctor, I heard you talk earlier about your time early in your career, and I heard the great introduction, and I was just in your home city a few months ago for the civil rights commemoration in Selma, and I want to close out with that. But you know, you talked about traveling around to rural Alabama and seeing health disparities and health outcomes. And I wonder, you know, you work in a city, but you have this background working in rural health. How do you see the impacts of these policy decisions impacting the communities that you work with?
Well, Heather began with saying about the pandemic. And that truly had a negative effect on a lot of physicians and nurses. But lately, like you just said, it's the policy, it's the disrespect, it's the lack of belief in science and physicians, and rather believe in something you see on TikTok or the internet. And so a lot of younger physicians are saying, why should we go into this if they're not going to believe us or trust us to give them adequate care? And we can make more money doing other things besides going into the hospital and seeing patients. So we have to reverse that. The trust has to come back to the I had a patient that was telling me he didn't want to do a certain procedure because his brother, who finished maybe the third grade, was advising him against it. And so when we get this type thing based on people, everybody's a physician now. All you gotta do is go on the internet and create yourself. And so we have to get back to trusting people, better conversations with our patients. There has to be a mutual respect between the patients and the physicians in the healthcare community. And then we can do that. And hopefully we can get back to we the people so that the politics in healthcare can be removed. I know right now in Alabama, we have gone from 24 navigators to 4. And as I mentioned before, a lot of our people don't dial up. So they can't go to the exchange online. You have to go and visit them. So if you've gone from 24 to 4 navigators to cover the entire state, the effects are already happening regardless of what happens with the extension of AXP.
Yeah. And I'll just close out quickly, if it's okay, Madam Chair, with just one quick note, if it's okay.
Okay.
I had the opportunity, as I said, to travel to Birmingham, and I heard this story when Representative Sewell introduced you. And I got to meet Miss Ruby Shuttlesworth, who was the daughter of Reverend Shuttlesworth of the Civil Rights Movement.
Yes.
And hear the stories of the kids who were involved in the Children's Crusade in Birmingham. And the thing that I was struck by, and I want to just leave this moment with, is that in 1963, thousands of young children from Birmingham, Alabama, showed up and protested for civil rights. Children as young as 11, 12, 13, they were arrested. They faced violence. They faced dogs. They faced guns. And if those children could be brave enough to stand up to what they knew was going to happen to them to change the course of this country, we can be brave enough to stand up to Donald Trump and these Republicans. And so I say to you, thank you for being on the front line of this fight.
It was one of my most proudest moments. Thank you.
Thank you.
Thank you, Representative Stansberry. America is facing a healthcare crisis, and it's a crisis that was created by Donald Trump and Mike Johnson. And they've cut Medicaid. They've attacked Medicare. And now they have shut the government down because they would rather see millions of Americans experience massive price increases on their health care. And if Republicans refuse to reverse their Medicaid cuts, millions of Americans will lose their health care. We've heard some of that here today. If Republicans don't work with Democrats to extend the ACA tax credits, Americans will have to pay double or triple the current cost for their health care. We know in California just today, they've opened up the system so people can go online to check. American families should not be stuck with the high cost of the Republican failure to act. That's why we are here. Democrats have continued to show up for our constituents and the American people during this Republican shutdown. We call on Mike Johnson to call House Republicans back from their third week of vacation. We want him to work with us to reopen the government, and Mike Johnson still has no strategy on how to reopen the government and protect Americans' health care. He said so himself today. Well, Mr. Speaker, Democrats have won for you. It's time for House Republicans to get back to work so we can reopen the government and stop these dangerous price increases on health care. So I want to thank each of you today again for your time, for your stories, for your courage, for being here, for taking the time to be with us, listening and sharing your story. We are here because of you and the millions of families that you represent. So thank you, thank you. This meeting of the Steering and Policy Committee is hereby adjourned.